this time. So. Land acknowledgement. We would like to acknowledge that the land we stand upon today is the traditional territory of the Anishinaabe, the Haudenosaunee, and the neutral peoples. Can I get a mover and a seconder for confirmation of the agenda, please? Moved by Councillor Wilby, second by Councillor Deal, that the agenda as amended to include item 16, a motion to go into closed session under section 239, paragraph 2, subsection C of the Municipal Act for the regular meeting of council dated September 5th of 2023 be adopted. All those in favor? And motion carries. Thank you. Is there any disclosure of pecuniary interest for any member of council this evening? I am going to declare one. I did not write down the number, and there's also a potential bylaw at the end of the meeting. I don't have any financial attachment to it, but it is a piece of property that is right beside the business I own, and I also have another family member that owns land adjoining to it. So just to avoid any conflict, I'm going to declare for that portion of the meeting. Can I get a mover and a seconder for the minutes of the previous meetings, please? Councillor Chartrand, Councillor Morrison. Boy, I haven't said that name in a while. That the council of the municipality of Huron East approved the following council meeting minutes as circulated. The regular meeting of August 8th of 2023. Any comments or questions on the minutes? All those in favor? And motion carries. We have a consent agenda. Are there any requests to remove any of the items from the consent agenda at this time? Councillor Fisher.
Thank you, Mr. Mayor. I think it's 6.3. Someone could tell me which one.
6.3 is the Ministry of Municipal Affairs and Housing Building.
Yes, thank you. Thank you. There is a part in there that they're designating 10% of some huge amount of money for rural and First Nation, etc. I would ask that staff be well aware of that, and if there's any chance of us getting some, to be ready to go after it with the 1, 2, 3, 4 developments that we have going on. We should get lots of points from Mr. Ford and big bucks, maybe.
Yeah, I think it was 1.2 million for the entire province, if I remember correctly. And then I think 10% was for northern
and rural, wasn't it?
Northern, rural, and First Nation indigenous.
Yeah. But anyway, just yeah, if that could be on the radar, please, of the staff. That
okay, thank you. Is there anything else that anybody wanted pulled or comment on? Okay. Can I get a mover and a seconder to accept, please? Moved by Deputy Mayor, second by Councillor Fisher. That the consent agenda items 6.1 to 6.10 be received for information and approved. All those in favor? And motion carries. Public meetings, hearings, and delegations. 7.1, we have a delegation. Andrew Williams, President and Chief Executive Officer, Huron Healthcare Alliance, 2023 update. Welcome, Andrew.
Right here.
Yep.
Your worship, members of the council, really appreciate the opportunity to be here tonight. My office is not air conditioned, so I went in this morning and I almost turned around and turned back home. It's really hottest time of the year, so it's great to be here where it's at least air conditioned. So, I'm here. Brad reached out earlier in the summer and asked that I come and present. The focus was on EDs and on staffing. So I thought what I would do. I haven't been here for a while. Thought maybe just give some history and context about the organization, and obviously address the ED piece and answer any questions at all you have, as I'm hopefully going to be able to do. So, for those of you who don't know, I represent an organization called the Huron Healthcare Alliance. We formed actually over 20 years ago when the 4 boards of the Seaport Community Hospital, Clinton Public Hospital, St. Mary's Memorial Hospital, and Stratford General Hospital decided that coming together as a larger group would help in the environment that we were in. So we run as if we're one organization with a single board of directors. All of our staff are employed by the HPHA, so they can move around from site to site if they wish. And it's actually one of the things that we recognize, that we're seeing a lot of movement in healthcare and people deciding to go to different locations and to provide as many job opportunities as we could. So that was the driver behind our organization being formed. Just to give you some sort of context on the type of organizations, we have a budget of about $175 million. We have a capital 5-year budget of $75 million. So we're constantly looking at our 4 facilities, and they're all various ages, as you would know, with various needs. So we're looking at that very closely. We have about 1,300 staff across 4 organizations, 150 professional staff, and those are mainly physicians. But we also have in that group midwives, nurse practitioners, and dentists. And we have about 500 volunteers that support the organization in various ways, whether it's gift shops or supporting patients or fundraising. Just go right down the list. Last year, just a few activity highlights. We had about 62,000 emergency visits across our 4 sites, and about 12,000 would have been in Seaforth. We had 1,100 deliveries, 10,000 diagnostic tests, ultrasound, CT, MR, those types of things. About 1 million lab tests. We have a 16 lab hospital lab partnership across this region. About 10,000 day surgeries, and then about 2,000 inpatient surgeries. So fairly busy organization, and obviously each site is a little bit different in what it does and the focus, as we've decided and determined over the years. We do offer a lot of services in this area, and we know healthcare quite well. And obviously in Huron East, we're very much focused on Seaforth, but we do have 5 hospitals in Huron County, and we have 8 across Huron Perth. We have another 11 in Grey Bruce, and 3 in Oxford, and 2 in London, and obviously Middlesex. There's a lot of hospital activity in this area, which is good on a lot of levels, and it's not so good on the level of competing for people, as you could imagine. But we try to make sure that, as a group of hospitals, we offer the types of services that should be available. So we have internal medicine, general surgery, orthopedics, urology, ophthalmology, obstetrics, gynecology, plastic surgery, ear, nose, and throat, family medicine, psychiatry. We operate what's called a Schedule I facility out of our Stratford site, which means we can have people there against their wishes. We have emergency medicine specialists, we have anesthetists, and we have what are called hospitalists, who are physicians who, in essence, support the inpatient side of the organization. We have a lot of programs that sort of cover the entire region. We are a district stroke center. Lots of changes over the years, as you know, in healthcare. Stroke is probably one of the leading examples of that, where if I were to have a stroke right now, I hope I don't, but if I did, the ambulance would pick me up and would take me right to Stratford. I would bypass all the other hospitals because Stratford has the appropriate technology for strokes. And so there's a lot of things that are changing on an ongoing basis when it comes to the type. We have the district stroke, we have chemotherapy and dialysis, which we partner with London in offering those services. I mentioned the lab partnership that we have. We have a lot of outpatient mental health programs. I was pleased to see at the recent AMO conference in London that outpatient and mental health and addiction supports were top priority, because that is what we see as the #1 need in this entire region and right across the country, is how we support people from youth right through that area. We have RT, versus respiratory therapy, social work, physio, occupational therapy, diabetes education, speech language, small talk, which is speech language for kids, a breast screening program, and as I mentioned, diagnostic services. So we have a lot on the go. There's lots of things happening. And like every business, and I include you guys in this, we have hot button issues, right, that are a challenge for us. And they're not unique to us. They're everywhere. I have the opportunity, is one of the things that I do. I survey with Accreditation Canada, so I've been all across the country. I've been internationally reviewing hospital systems, regions, and it's pretty similar everywhere when you look at the challenges that we're all facing. First, staffing, and I'll get into this in a bit more detail. We have significant challenges in staffing, and it sort of ebbs and flows over time as to which area we have challenges in, right? Like right now, it happens to be emergency nurses, medical lab techs, are a challenge. Physicians are a huge challenge, particularly comprehensively trained family physicians. But it does, over time, it shifts. We could, 10 years ago, we couldn't get pharmacists. Now we can get pharmacists. So it does, they're very. Funding is a huge issue for us. We probably I've been in the system a long time, and I've never seen a year where we've had so much unplanned salary expenditures at the last minute. So you all heard of Bill 124, which was the sort of the wage freeze in place during the pandemic. That was rescinded. So we went from a $3 million projected surplus last year to $1 million deficit. So we had to spend $4 million in staffing costs that were unbudgeted. And then that's carried forward and probably at the largest financial challenge that we've ever seen. And it continues, right? And it's not going to go away, unfortunately, in the short term. We're very fortunate, on a bunch of levels. We have incredible foundations, including at Seaport, that step up. Our communities are very supportive, so we're very lucky. But on the operating side, huge pressures. Bill 60, which some of you may have heard of, is a government plan to look at shifting certain procedures into private clinics funded publicly. We've expressed our views on that. We're a little concerned for rural communities where you have low volumes to begin with, and we're not going to see the private facilities set up in a smaller community. So we're certainly working closely with Ontario Health and government to make sure that our views and the views of this region are heard. ERs cannot open a newspaper for those who read newspapers anymore, or open your smartphone and not see challenges in the ED space. And it's really become front burner issue in Ontario in the last 18 months, probably, although this has been an issue across the country for years. And as everybody in this room, I'm sure, is aware, back in 2009, we actually reduced our Seaport emergency department for a couple of years to just during the day for the exact same reasons that we're dealing with today. For the exact same reasons we're dealing with today. We've had our Clinton ED that reduced hours for 3.5 years. We've seen last minute temporary closures here, as well as in St. Mary's. And I have not talked to any hospital that has a full complement of staff in their emergency departments, or really any program. So when you see the issue of a smaller center closing, don't think that everything's fine in the bigger centers, because they're often operating at half staff, right? So in our case, if we go to half staff, only one person, so we have no choice but to reduce hours. But it's a challenge everywhere. And it's very much driven by RN availability and also physicians. So what are we doing here on that issue? So we've seen this calendar year 12 temporary reductions in service. All have been driven by last minute nursing availability. And I'm not being critical of nurses at all, because they're working really hard. But when you have a very small number of people, if you have a last minute sick call, and you don't have anybody to replace, you really are not left with any option but to reduce the hours. And so when we make those decisions, hopefully they're not the right decisions to make through the lens of a lot of people's eyes, but it's the responsible and safe decision for us to make, and they're only made after us exhausting every option. We do rely heavily on agency nurses, so private businesses who hire nurses and then they contract them back to organizations. It sort of compounds the problem, because a lot of these agency nurses leave organizations that then become more desperate for staff, and then go back and work in a different model. We actually had in Seaport over a 6-week period in the summer, 27 shifts that were partially or completely covered by agency staff. So a big challenge. Physician coverage, we haven't had to do CPs in our region because of physician availability. But physicians, there are different programs that are available. So there's a program called the Emergency Department Locum Program, which is administered by the province. They have a roster of physicians who've agreed to move around the province based on need. You have to register as a hospital to be on that program. Seaport, as of June 1st, was on it because we didn't have enough local physicians covering the shifts. So we're part of that particular program. There's 30 hospitals in the province that are on it. So you can imagine the competition that exists there. There are incentive programs for physicians around payment. There's a summer incentive on the income side, which helps significantly in covering shifts. But as you can imagine, when your Seaport ER is paying more per hour than your Stratford ER or your London ER, the docs move from the larger centers, and then you have other issues down the road. So the system is certainly in a bit of a state of flux. And as we look to the future, I wish I could say to you that it's rosy, but it really isn't. It's only going to get more challenging, and it's going to, I think, morph into being more of a challenge with physicians versus nursing. And we, as small communities, we very much depend on comprehensively trained primary care providers, physicians who do a little bit of hospital work, ED, inpatient, primary care, long-term care, do the waterfront of what we would need. We are seeing fewer and fewer and fewer of those individuals graduating from medical school, right? So when I started in Seaforth back in 1997, I think we had 6 or 7 physicians here that did everything, right? They covered all of the services that we needed. We now have 8 full-time positions in this community. And based on their demands and what they're telling us, they're going to be able to cover about 40% of the ED shifts and maybe 45% of the inpatient. So we are very much dependent on finding external people to come in and help, right? They're called locum physicians, and we work hard to try and do that. So the challenge for EDs is significant, and there's a lot of conversation ongoing. Provincially now, I sit on the board of the Ontario Hospital Association, and we have a small rural northern ED advisory working group that's brought together people from across the province to look at the issue, to see if there's any provincial strategies we can put in place. In saying that, I will tell you, listening to the northern hospitals talk about their issues versus the southern hospitals, it is like night and day, right? As much as we don't like to close an ED in this area, we have 21 hospitals within an hour and a half of one another. Up north, they don't have one for 200 kilometers, right? So the challenges are huge, and they vary, by where you're located. But the nut of it is there's not enough people to staff what we are currently offering, right? And it's not necessarily going to get any easier in the short term. It just takes quite a while to train. So having said all that, and being negative about the ED piece, there's a lot of really good things that are going on, right? And I think the unfortunate narrative right now in healthcare is very negative, whether it's the ED piece, whether there's 6.5 million Canadians without primary care access, which to me is a national embarrassment, right? And this didn't just surprise us. We've known for quite some time. If anybody read Boom Buster Echo back in 2000, when it was written, the writing was on the wall. When the last of the baby boomers retired, we were going to see this massive issue, and we had it compounded by the pandemic. So no great surprise, but there's a lot of fantastic work that goes on every day in our hospital here and right across the system. And I really want to underscore how lucky we are to have the people that we do in this community, in this region. And a big part of that is the support from groups like yourselves. But we have done a number of really great things over the last little while. We went through a stroke distinction review. We're a partner with 8 other centers across the Southwest, working with Accreditation Canada to make sure we're providing world-class stroke response and care to people in this community. And we are. We're a leader in the Ontario Health Team model, which is a newish approach in Ontario to regionalization and integration, expecting us to work closer together with all of our partners, which we do. We're very much engaged with all the sectors, whether it's long-term care, home care, primary care, EMS. EMS is an incredible partner with Huron EMS and PERT EMS in a lot of different ways. And we had, I think, a really strong positive response to the pandemic. As hard as it was and as challenging as it was on everybody, we're very proud of how our team stepped forward, did what they needed to do to support not only themselves and the region, but to set the tone for the province. So I'm happy to respond to any questions at all. That's a quick snapshot of who we are, what we're doing. The ED specific issue, which is an issue that's going to be with us for a while. And I wish there was a magic wand on how to solve it, but there isn't. And so, we end up having to make reactionary decisions, which are not good for anybody, and very stressful on staff and physicians, but it's a reality in which we're working, and we're doing our best to try and address that and mitigate it. So happy to answer any questions at all or anything that would help.
Questions from council? Councillor Stephanie.
Thank you, Mr. Williams. I have a few questions, so I'll just keep it quick. Youth, that's one of our passions. What do we have in our area under HPHA for youth inpatient and youth mental health?
Yeah, good question. Great question. Actually, one of the gaps is adolescent trauma. We don't have any inpatient beds in this region or in Huron PERT. We would look to London for our patient supports for children. We have a child and adolescent psychiatrist who's fairly new to the area, which is positive. And then we have a number of community partners that, as you would know, who are in that space and providing service. So it is an area, as I mentioned, the biggest issue, I think, in healthcare today. It's not EDs, not being open. It's the fact that we're not supporting from a mental health and addictions point of view, everybody throughout their lives and allowing access when they need it. So it's a gap. I will agree with that 100%.
Thank you. Your work is much appreciated. One of the big concerns that I see, here around is communication. We have Huron Perth Healthcare Alliance, which we represent. We have Huron Health Systems. We have Listable Wingham. Within Huron Perth County, we have 3 CAOs, CEOs. We have 3 different organizations. Yeah, we have an Ontario Health team that's really pushing towards integration, working together. Personally, I see it as an administration overload and an employee underload that we're all not willing to give up our own backyard for the success of our community. But, your work is appreciated. You've been around 30 years. You've seen a lot more of this. The Ontario Health team's not new. It's a reincarnation of prior administrations. I really do question the fact that we're all trying to work together. We're not working together.
Yeah, those are fair observations. And I think, the Ontario Health team, if you ever read the sort of the introductory document that came out, I think in 2019, the vision for those is that they would work with a defined population, so in our case, Huron Perth, and all the money for all the providers would go into the Ontario Health team and then would be allocated out based on priorities, right? We're a long way from that.
Right.
And again, if you follow the HPHA, we're very committed to integration and partnerships. Ontario is the only province in the country that still has independent boards, right? So I mentioned I survey, when I go out west, if I survey in Alberta, they have one board for the entire health system, which has its upsides and it has its challenges. I'm a big proponent of local engagement and local involvement. However, it cannot be a barrier to working closely together. And I think that's, what the OHTs were designed to try and address. And over time, as you know, the precursor to the HPHA was, the Hospitals Partnership that some of you would be aware of. We went from 8 hospital CEOs to 1, and then we had an integrated group, which in 2003 pulled apart, and the HPHA was formed out of that. We do try and work closely together with all of our partners. We mentioned a lot of the services that we offer within the HPHA. We only offer orthopedics through our Stratford site, as an example, right? So we do try and make sure that we are coordinating and integrating services. The area that requires most work, I think, and we're doing some really interesting work through the OHT on stepped care for mental health and addictions, is that how we integrate all the various providers. And, we went through some changes recently with the CMHA office in Huron Perth, and Choices for Change is now morphed. And so we work really closely with them. On the duplication and overhead, we try really hard at the service level to ensure that we're spending every dollar we can where we need to spend it. But it does, circle back to the whole ED piece, right? If you had a magic wand and you were to create a health system for 60,000 people in Huron County, you wouldn't have 5 hospitals, right? You just wouldn't. So it's that push-pull right now where we're trying to look at what are new responsible long-term models of care. How do they support the communities, and how do we get the conversations going that are not very protected, right? I mean, you would live that, right? Yeah, so it's a challenge.
And these are not challenges, these are questions, obviously. And the last question I'm gonna have before we can talk about this with others is, when we have a ER closure, how does that look on the economics? It should help, because if we're closing for 12, 15 hours and we're not paying X amount, does it become an economic issue versus a service issue?
Yeah, it's not an economic issue, and I just want to make sure. You mentioned you're going to the meeting tomorrow night to try and quell rumors. Healthcare is wonderful for rumors, right? We're not reducing for money. I mentioned the agency nurses. We've spent $250,000 more this year because we have agency nurses filling shifts than if we had our own staff, right? So we do save, I said it's supposed to save a couple of dollars on the shifts, But it's not appreciable at all. And, you know, when we look at, we've actually, you know, one of the things we tried to do as an organization, is we went to 2 nurses around the clock in our EDs. Not that long ago, just before we did the first reduced hour in Seaport back in 2008, we had at night nurses from the inpatient unit would cover back up on the ED. But as new graduating nurses were coming out, they were coming out as, I only want to do ED, or I want to do obstetrics, or only inpatient. So we didn't have that luxury, right? So we went to 2 ED trained nurses around the clock, which we thought would help with recruitment, but that's still a work in progress. We're spending a lot more money on our EDs, trying to sustain them than we're saving.
Thank you for coming.
Councillor Fisher.
Thank you, Mr. Mayor, Mr. Williams, for your presentation. Quick question, Ontario Health Teams, I still have a handle on, but maybe someday, but how are they going to impact the family health teams?
Yeah, it's a good question. So all of our family health teams are part of the Ontario Health Team. There's so many teams, it's all confusing. But what the Ontario Health Team forces us to do is bring all the different groups together. So we have, I think, 9 different primary care teams in Huron Perth. So they're all come together. We have a physician advisory council. So it helps with coordination. So the OHT, Ontario Health Team, will help with coordination of family health teams. Where I think we need to go to the next step is, are all of our teams, all of our hospitals, all of our community providers equally accountable for the services that they're offering? And I see a real opportunity with the OHT to try and answer some of those questions. But at this point in time, what the OHT is doing with family health teams is helping coordinate, helping to ensure that if one is doing something that's best practice, the others have access to it. So I think over the short term, it's going to help improve care. Over the long term, probably more integration of support services is my guess.
They might take something away from C4 and give it to Zurich.
No, I don't think they would take anything away from C4, but again, it goes back to the question earlier about, you know, duplication and all that sort of stuff. And what we have to do is say, in Huron Perth, we have a population of 150,000 plus or minus. What is a responsible way to distribute services so that people have an equitable access to them? And I think, as I said earlier, I think the biggest embarrassments in this country is that there's so many people without access to teams-based primary care, right? And, you know, it upsets to many people. If you want a healthier hospital system, you need a healthier community. And to have a healthier community, you need to focus on wellness, you need to focus on social determinants of health, make sure people have good employment and food security and all that sort of stuff. And until we do that, until we shift that a little bit and continue to only focus on institutions and providers, it's going to be a challenge, right? So I think, you know, in the short to midterm, I'm optimistic that the OHTs are going to help strengthen services, but that doesn't mean it's going to be the same, right? And I mean, anybody here runs a business. If you're going to commit to doing the exact same thing 5 years from today as you are today, you're going to be out of business. And healthcare is no different, right? We are constantly evolving and looking at how we do what we do. But having that local access to care is a priority, you know, for us. And so, you know, we look at what makes sense to be in Seaport, what makes sense to be in Zurich, what makes sense to be in Stratford, in London, in Kitchener, and the whole system kind of networks together. But it's hard. I mean, the OHTs are difficult because you know, the government has come out and has been very loose in their expectations, right? I mean, there's been 3 or 4 waves of OHTs approved. We were in the first wave. There were 15 or 18 approved across the country, across the province, but they're very loose in what they should look like. So anybody here who's tried to work with other municipalities or other organizations to try and get agreement on change, it's not easy, right? And we're dealing with that big time right now in the healthcare space.
Thank you.
Councillor Chartrand.
Yes, do you partner with the Seaport Long-Term Care, and if so, what's the link?
Yeah, good question. Formally, no. Like we have some formal partnerships with a couple of long-term care homes who provide IT support. We have do HR, some recruitment for some of the homes. They are part of the conversation with OHTs, and there are long-term care groups that connect in. So with the Ontario Health Team, there's a long-term care sector that's at the table. So we are connected through that way. And, you know, the company here is a parent company, so we have other relationships with them. But operationally, there's not a direct link between our organization and theirs. Over time, I think we need to do more of that and work closer together. Because in Huron, we've got an awful lot of really small organizations. And I mean, we're 1,300 people and we have challenges recruiting. You can only imagine what it's like in the really small organizations, right? And so the more we can work together, the better. But we deal with the long-term care space. There's municipally run homes, there's private homes, right? There's not-for-profit homes, so sort of 3 different models, and we're trying to work closely with each of these as best we can, but not a formal link in that.
Deputy Mayor.
Thank you, Mr. Mayor. Through to Andrew, thank you very much for that presentation. One of the buzzwords coming out of provincial government when they talk about healthcare is private clinics. You see them as siphoning off maybe some of the physicians and nurses. I'm not sure if there's even any private clinics within our area or not. But it's, it seems like they may get paid more money, maybe have a 9-to-5 job versus 24/7 type thing. Do you see them being a help or a hindrance as well?
Well, I will say one thing, the fact that people have to wait as long as they do for certain procedures, that is something we need to deal with. So we've been very clear with the government that we support any effort that is trying to address access. Now, in saying that, we're also on record with these particular private centers to say, before you contemplate that, look at the capacity you have in your hospital system already, and maximize that, because what will happen is you will see people either migrate out of your hospitals into some of these clinics, or they'll just graduate from university and go right into these clinics, right? There's one clinic in this province that is very well known, provides great service. If you go on their website, they're advertising for anesthetist Monday to Friday, no call. I can't compete with that, where I need an anesthetist to be on call for obstetrics. And so if you're a young anesthetist thinking, well, I can make the same money there Monday to Friday versus here 7 days a week, what am I going to do? So I think there are risks. I think we need to be better at addressing the access issue. And a lot of it does come down and, the whole system's knitted together, right? And some of you have heard me talk about the ED issue a lot, and we had a proposal from the government 15 years ago to change the ED model in this region, right? Because we felt that people and resources could be better spent to support healthcare, rather than trying to sustain a whole bunch of services every 15 minutes. So we have to be better at how we allocate resources, because what's going to happen is people are, demographics, and you look at how willing people are to really be aggressive. We're getting a group of people that are coming into the system, or people that are looking for service who don't care. They'll say, absolutely, if it's in my best interest, I'll go to that private clinic. So I worry a bit that we're trying to solve an issue that needs to be solved, but we're maybe not taking the steps we need to get to the right solution. Because I do worry when you're dealing with a worldwide shortage of healthcare professionals, not just in Seaforth, it's like worldwide, right? If you introduce other competitive models into that, it makes it more challenging. So I do worry. And I think, we would love to have a more robust offering of services in our region. But because we don't have a large volume of people, but these private centers are not going to set up, right, in other than really large centers. And the way the government has introduced Bill 60, it starts with cataracts and expanding cataract access in Windsor, Ottawa, and Kitchener. Then it looks at scopes, endoscopies, things like that, and then potentially joints, hips and knees. But if you look at, just take scopes, for example, we have 7 fantastic general surgeons in this area. We're very lucky in the HPHA, and there's more across Huron. The only reason we have 7 is because we have enough work to keep them viably employed, and a big part of that is scopes. So if you skim off stuff and you send it to larger centers, you undermine the viability of other services, right? So we always say to the Ontario Medical Association, the government, just make decisions with your eyes open and understand there's consequences. When you squeeze a balloon, it pops out somewhere else, right? And that's very much the case with these clinics. If we don't expand them in a coordinated way and understanding what are the impacts going to be, I worry a bit that there be some unintended consequences that will just make the short term more challenging. But we need to do better on access. People have to wait for hips and knee replacements and things.
Councillor Sharkran.
Yeah, is there any group that's looking at bringing doctors and nurses from other countries?
Yes, there are. There are a number of, particularly on the nursing front. We have in the Southwest, we've brought together recently a lot of the recruiters. So we have a lady named Lori Roberts, and she's working with a counterpart from Hamilton and Niagara to get a presence in international recruiting. So that is part of it. We have my personal opinion, having gone and surveyed in the Philippines and Saudi Arabia and other places, an affluent country reaching in and pulling healthcare professionals out of another country that needs them just as bad as we do is not a really good strategy. Getting the people who are here, and we have a lot of people in this country today who are healthcare professionals in their own country who've not been able to, for licensing reasons, practice. So there's a big push on that right now to say, okay, what can we do to expedite training to get the people that are here in a space of working? And we've had some internationally trained people in our organization. So it's a very successful program. And when we do go out to international recruitment fairs, which we're looking at doing as an organization, we want to be just very mindful of making sure we recruit the people who are either coming here or have connections here. There's a lot of people who are Canadians who go and do medical school elsewhere. There's a lot of people talking about how to get them back in the system. So I think there are things we can do to help with that issue. But it doesn't take away from the fact that the overarching global issue is there's not enough healthcare providers, right, to support the needs of the communities that we have across the province and across the country. But it is one of the strategies, absolutely, when we're looking at how do we get the people that are here working, number one, and then those who perhaps are from Canada gone elsewhere to train, get them back, and then more integrated recruitment.
I know in the Windsor area, I have two nieces and a nephew who were working in Windsor Regional Hospital and now work at Detroit Ford City Hospital. They're leaving the Windsor side and heading to the American side.
Yeah, been a lot of people have done that over the years, and again, that ebbs and flows as well, right? There was a time when, you talk to some of the nurses and assistants who are maybe older, they would say to you, when I graduated, I could not get a full-time job in Ontario or in Canada, so I had to go somewhere else, right? So that kind of ebbs and flows. But the US is in just as bad a spot as we are when it comes to need for nurses, and so your border towns, right, are really at risk of people moving back and forth, and we see that quite a bit. Although in the last 10 years, probably not quite as much as in the early 2000s, but it is a challenge. And then you look at people say, well, what can we do to help recruit locally? I mean, a lot of things that have changed, right? Housing. Young kids can't afford housing. So if you don't have housing, a housing supply, how do you draw people? 15 years ago, people may have been willing to drive an hour to work. Now with the price of gas, they're not. So you're seeing shifts in, what people are willing to do, where they're willing to work. And so how we set up our local communities is really, really important in our ability to attract, right? Selling the healthcare job is not hard. It's selling the family is the challenge, right? And saying, what's going to incentivize someone to leave the US or leave Nova Scotia or leave wherever and come to Huron East, right? So what are the check marks that we need to have in place? But it's very competitive. People say we have a public healthcare system. We do to a large degree, but it's remarkably competitive. And so just going back to your question, Deputy Mayor, one of the largest parts of our health system is private delivery, and that's physicians, right? And so we already have that in our system in a big way. And I'm on record as saying, I think public pay private delivery is a bad policy decision if you don't have very clear accountability and expectations in what should be happening and where. Right? I mean, there's an argument to be made that we have enough family doctors in this country. The distribution is not right. And sort of the volume of people that people have is not perhaps at an equitable level. So there's a lot of things we need to do differently. And I welcome any advice because it's not an easy space to be in. Right?
Councillor Stepler.
Yeah, I just want to wrap this up first. I think, thank goodness you've been around for a long period. But does this not really resemble a lot of the previous government administration of the Ontario Health Network, of the Ontario Health Team? We're doing the same things over and over, and until there's a systemic change and somebody's willing to make the hard decisions that we all see, we're gonna be here in 20 years doing the same thing. Like, it's the hard decisions that need to be made, and they're not all gonna be popular. But thank goodness you've been around and
I don't
held our
disagree.
ability for many years to see that, because we would. During the, PC government of whatever, and I'm not blaming any color, but it's the exact same thing we're doing 30 years in the future.
I mean, we're all to blame, I think, right? I'm a provider, I'm to blame, and I go back to the physician piece, the fact that we have 6.5 million Canadians that did not have overnight. We've allowed that to happen, and whether it's with our education system, I mean, taking my HPHA hat off and my Huron East hat off and my Seaport Community Hospital hat off. And I agree with you, someone needs to stand up and say, we need to make some tough decisions. Like I alluded to it a minute ago. So unhealthy hospitals or a healthy healthcare system, you need to help your population. And there are ways you can deal with that. But unfortunately, doctor and architect, they will always say your form should always follow your function. In healthcare, we've done it the exact opposite,
Oh.
right? We've got the function, the hospitals, and or the form, and we fit the function into it. And that's the wrong way to go. And I've got a list of things that I think we need to do. I'm going to share them with you, because they're here. But I think number one, we need a national commitment to every Canadian having access to teams-based primary care. And that, I mean, people say, well, how do we do that? Well, you can do it, right? You work with set population health standards around access to primary care. Then you work with your education systems. You look at distribution. There's things you can do. We need to ramp up accountability. We're not as accountable as we should be in healthcare. And part of the reason is we're very politically driven. I don't mean big P or just everything is political, right, in healthcare. We need to mandate best practice adoption, right? I mean, there's things going on in our organization that other organizations can learn from, and vice versa. We need to mandate that. We need to support caregivers better, right? The largest group of people providing healthcare in this country are caregivers at home, supporting loved ones. And are we doing everything in our power to support them? We need to do that. We need a national plan for integrated health data. It's an absolute travesty, right? The way we do not coordinate the flow of information and the rework that requires. We need to look at population health planning, which I think is huge. We need to remove licensing disparities provincially, and we're doing that now, right? Where if you're a physician in BC, you don't have to worry about getting a license, you can move across the country. We need to mandate full scope of practice. Right? Are you using all the disciplines to their full capacity? Are we using nurse practitioners and PSWs and everybody? Are they really working to full capacity? We need to really double down on social determinants of health, right? As hard as maybe that is, I mean, we need to do better at supporting our populations, and because that pays dividends down the road. I mean, when I look at the hospitals today, there's probably 20% of the people that are in our hospital beds who are waiting to go somewhere else. And they can't go somewhere else because there's no home care or whatever, it might be long-term care. But there's a big chunk that come in the first place because they haven't had upstream supports, right? And that can be short-term upstream or longer term. So we need to do that. We need a national HR plan in this country. This fighting with each other and competing is not a good plan long-term. And then we need an infrastructure. So there's a lot of things we can do, but the government does have to be willing to lose the next election. But then I don't think they will, because they'll come out and they'll make some really tough, take some tough stands, and then we all have to support it, right? Because Andrew's philosophy of planning and healthcare is you have an idea, you take it out to community gets mad, politicians tell you not to do it, start over again, right? And that's the cycle we get into. We're gonna need people to say, yeah, I gotta step away to do it. And look at it as a blank page, and what makes the most sense with 150,000 people in here on Earth. Right, but it will take a lot of gumption, because everybody's got an opinion on healthcare.
Thank you.
Andrew, you asked if anybody had any suggestions on how to fix the system. I don't. But I do want to question. I do want to question one of the things that you had commented on, and it's about the private healthcare. And you said that if they were going to do one, they're only going to do it in the larger centers. And I guess I kind of question that philosophy, because I think there's certainly an economic benefit to be made from a small center of having an operation like that in this neighborhood. I understand from your point of view that you don't want to lose doctors, nurses, or any staffing that you have available to you for any medical centers you've got now. But, I unfortunately or fortunately know a number of people that have used those private health clinics, raved about them, mostly for how fast they got in. Also did appreciate the level of service or type of service that they got there. But they also had family members that would go stay in a hotel for 3 or 4 days or whatever, for how long they were gonna be there. It's gotta be a heck of a lot cheaper to come and visit rural Ontario for 3 or 4 days than it is to go and stay in the Sheraton downtown Toronto for $500 or $600 a night. Is there not an argument to be made that there would be a benefit because there are such long delays for certain procedures from time to time in the general system that by just removing those, but still having them in the rural area would not hurt us overall?
Yeah, I think, again, my personal view is we've got capacity in our rural communities that we should be utilizing to do things like cataract surgeries, right? Instead of growing them in Kitchener, why not look at, if we do Clinton as the cataract for Huron Perth, let's look at expanding that. So I agree with you 100%. My only point is, if you're looking at a private company that's going to set up, they are going to be very much driven by volume of work that they can push through the model of care. And it's hard to convince them to come into smaller communities where almost everybody has to drive in to get there. So I would love for us to be able to do that. And we're going to be putting forward to the government ways that we can strengthen in our region the services that we offer, right? Maybe in line with this bill. But I honestly do think that when I look at the ones that are set up across the province, they're all either in London, Toronto, Ottawa. So it'll be a tough hill to climb in the short term, which is why we want to really try and get ahead of that and say, we've got a lot of capacity in here on Perth. Let's use that first. And let's try and attract people here to provide that service. But go back to my call comment. It's hard to say to someone that come into this region and be on call every fourth night, or if you're a lab tech, maybe every third night, versus going to Barrie and be on call once or twice a month, right? I mean, we have a lot of really tough things to sell when it comes to attracting people. Quality of life is outstanding, right? And all those things are really, really positive. But the actual health, the working in a hospital or in a community in smaller, lower volume centers puts a greater burden on staff, right? And that's a hard sell. So I agree with you 100%. We should be doing more of it. And we are absolutely going to be advocating for that. And we'll maybe look to you and others to support us in that because it will benefit all of us. But I do worry a little bit that if this gets traction, and who knows if it's going to get traction, right? Because there's going to be opposition. But if it does, we want to be part of that mix because 150,000 people in Huron Perth and 140,000, whatever it is, Bruce deserve the same type of access, right? If they do a picture.
The only other question I had is that it doesn't matter what the rest of the world is doing at this point, but I do believe it's the Ontario government that sets the number of students that go through for medical, at least in the nursing profession. Is there any talk from the province about upping those numbers? And if they are trying to increase those, and I do believe they have been because I've heard of different programs out there. I know you say it's going to take quite a while, but is there a specific timeline of when they're kind of guesstimating that we're going to get over the hurdle?
There have been an increase in slots in education, right? Whether it's nursing or medical school. I use medical school, you've got a 4-year medical degree, and then you decide what you want to do, right? And if you want to be a family physician, there's a further 3 years. If you want to be a neurosurgeon, God knows how long it is, another 20 years, right? So your window from today to down the road is quite lengthy. Nursing, you're 4-year degrees. But the first thing we need to do is we need to say, we've got a population of 150. How many primary care providers do we actually need? Right, and we need to do that Canada-wide, and that's okay. How many are graduating? And I mentioned the comprehensively trained family physicians. Use Heather Percival as a great example. Incredible physician locally. When I got here, she was doing ED, she was doing obstetrics, she was doing inpatients, she was doing primary care, trained coming out of medical school to do all of that. Now, primary care physicians are coming out and they only want to be a hospitalist, or they only want to be an ED doc, or they only want to do primary care. So communities like ours that depend or have depended on these comprehensively trained physicians are in a bit of trouble. I hate to say it. And there's maybe ways we can turn that around, but it's gonna take an awful lot of rethinking from that, right? Like, I personally think that you should be admitted into medical school, into primary care. And then you shouldn't, at year 4, they have what's called CARMS, which is the Canadian Residency Matching Service. So, all the medical schools in the country, there'll be X number of orthopedic residencies. So all these people put their name forward to be orthopedic surgeons, and a certain number are successful and a certain number aren't. We don't have all of the family practice residencies full. And I mean, to me, there's easy, he says with air quotation, ways to deal with it. Very hard from a practical point of view, but we need to be smarter and more intentional, right? We have a public health system right now that we allow to evolve with market forces. So you graduate as a primary care provider, you can go wherever you want, right? And to me, we should be much more intentional and say, we need people here, here, and here, and here's how we're going to manage the system. Because if you don't do that, then people will evolve in ways that maybe aren't going to support the system. And in rural communities, it's a big worry for me, to be really frank.
That's interesting and idea there. And I think there's merit to it. On September 11th, is that just a presentation or an open discussion?
That's more of a quick presentation. Yeah. But we are going to have, it's one of the things that we're going to be doing more of going into the fall and maybe having more discussions out and about around kind of what's going on in healthcare, what sort of temperature check in our communities, what's working well, what's not. Because going back to some of the questions today, I mean, we're going to be dealing with the same issues 5 years from now, unless we do something really different. But getting to do something really different today does require a very thick skin, right?
And
yeah,
I want to wrap this up too, but I think there's merit to your comment there because I remember 30 years ago when I looked for a factory job. Maybe it was 45 years ago, anyways. But the bottom line is that you knew that there were certain positions open in certain places where that's not what people wanted. But if you wanted a job, that's what you applied for, hoping you could get something else down the road. There's maybe nothing wrong with the fact that we've got so many openings for this, so many openings for this, so many openings for this. Maybe you have to commit to actually providing that service for a number of years. And then if you want to move on to something else, that may be a step in the right direction in solving some of these problems. I'd like to see if there's a way that we could forward that idea.
I always think in life, if people know the rules of the game before they decide to go into the game, they're much greater success versus saying to a group now, by the way, we've been doing this for a whole bunch of time. Now we're going to push you over there. I think that's a no-win scenario, but there's no reason in the world we can't say we need to change the construct, right? And we're going to look at a 20-year plan. I mean, when I do presentations with PowerPoint, I have a picture of my full granddaughter, right? And I want her to have access to the best care she can get when she needs it. And I know full well that that's not going to happen unless we start to fundamentally shift. And the reality we're living today is because of the decisions we did or didn't make 20 years ago, 30 years ago, 40 years ago, right? So you can make a shift, it doesn't say it's not overnight, right? And so you deal with a lot of chatter and a lot of noise in the short term because you're ending up having to react and respond to a reality that doesn't support what we're doing. I mean, that's
Maybe not, but even if an idea like that was accepted, you'd see light at the end of the tunnel, at least within a decade.
Yeah.
Because right now, the way we're going, a decade is not going to solve the problem. I do want to wrap this up.
Yeah,
Go ahead.
very key thing at the end. Two things. Private is about profit, because it's your own business. Public's about the taxpayer. You won't be able to compete. That's all I got.
Did you have your hand up, Diane? No. Okay. All right. Andrew, thank you very much for coming out and talking to us, bringing a lot of information. 7.2, we have an engineer's report, the Coates Municipal Drain, Matt Ash, I believe it is. Welcome.
Evening, council. I'm afraid what I have will pale in comparison to the previous one. And I will try to be brief because I understand there's a landowner here tonight with additional information that may necessitate revisions to this report at council discretion. So tonight we are are here to present the Coates Municipal Drain. This is a drain that serves concession 1 and 2 over in Gray near Maple Keys and Jamestown Road. We were appointed back in 2022, I believe it was May, to look at this system and held an on-site meeting at the drain in June of that year. This drain was originally constructed in 1913, but most of it was improved in 1979. There is some 1913 works remaining, but as I said, the bulk of it is 79. The landowners indicated that the tile drain was undersized and doesn't properly drain the lands, and they also indicated that the open ditch portion of this drainage system needed cleaned out. I understand your drainage superintendent has either undertaken that work or it's underway, one way or the other. That was actually some of the delay in finishing this report. DFO required a permit for that work, and we didn't want to proceed with the tile drain portion until the open ditch was looked after. So we did determine that the drain can be replaced. The main drain, as well as what's called branch A, can all be replaced with larger tile to provide better drainage. The land is unfortunately quite flat in the area, so that necessitated fairly large tile for the watershed area, considerably larger than what you would normally see in such a relatively small catchment area. The project does include 3 road crossings, 2 of them on Maple Keys and 1 on Jamestown. We did provide the standard crop allowances, probably 2 years behind the time, but that's on a macro. The cost of the project is estimated at $344,000 and will be eligible for the 1/3 of macro grant. I note that in tenders we've let lately, drain costs do seem to be finally coming down a little bit, so that's good news. Landowners, of course, can dispute their assessment, which is in the report at further revision, or they can appeal to the drainage tribunal as the case may be. We do not anticipate construction until 2024, probably late in the year at this point. So that is the summation of this project. Of course, I'd be willing to answer any questions the council may have. And as I said, I believe there is landowners here today.
Yeah, does council want to ask questions first, or should we hear the comment from the landowner?
Let's go to the landlord.
Okay, so I'm not sure who it is, but I was made aware by staff that there is someone that recognized some possible deficiencies or mistakes in the report. Welcome. Can you state your name, please, sir?
Yeah, I'm Kim Winger.
Welcome.
So my property is lot 63 and 64 in Great Township there. So basically, I just looked over the booklet that was sent to me and I just wondered if my own tile drains that were on my farm were taken into account. So I checked with Mr. Ash and he said they weren't really aware of that and that it would possibly make a change in the assessment. So I have a tile that, excuse me, it runs from Jamestown Road right back to the river. It's on the west side of my farm. And of course, there's a good portion of the assessment on my place that would be on the east side of that. So there'd be, I don't know what the assessment would change or how it would change or whatever, but it would probably make some difference if that knowledge had been known before, I guess. So.
Matt, if I may, or maybe it's staff that I should be asking this at this time, but is there a plan that if this was to go ahead, that there'd be any work done this fall?
I think you just said there's a meeting work
Till next year. So the fact is that if you were to adjust your numbers on the costing page, and this were to come back to the next meeting, it really wouldn't delay anything at this point, other than just possibly sending out a request for tender.
Yeah, the report would have to be revised and come back to your next council meeting, but as far as construction goes, I don't anticipate any change.
Okay. All right. Any questions at council at this point then? So staff have left me with 2 options here. We do have one motion that would allow us to send it back to have it revised. Or the other motion, if there was a belief that there wasn't going to be much of a change, then we also could carry on with it. So Matt, you've had the discussion with the property owner. Sorry, make you keep getting up and down, but do you anticipate this is going to make any kind of significant change to the report?
Yeah, he sent me his tile drainage maps and he is under drained out of the watershed to the river, so it will absolutely change the assessment. I don't know if it'll change the design itself at this point. I haven't really looked into that, but I think what he's presented is factual and fair in that there is a change. So I suggest that we do it, yes.
Okay. So if council doesn't have any objection, does somebody want to make a motion then to send this back to the engineer? To read, moved by Councillor Deal, second by Deputy Mayor. That the council of the municipality of Huron East under section 57 of the Drainage Act refer the report back to the engineer for further consideration. Any comments or questions? All those in favor? Carried. I do have to ask a question. Was there other members of the public here that were here for the drain this evening?
Yeah, my mother was.
Okay, does this inconvenience you, the fact that it's gonna go back and be reassessed?
The original and drain, you will see that that's the high point you're assessing me for, and they say I have no net value. And anytime, I've lived here for over 60 years and it's always been you have no net value, so you don't pay. Have you read that?
Okay, so, that there is under, what is it called, Alan? We have a separate meeting that usually.
That would be coming forward the quarter revision as part of the assessments.
Yeah, so there is a quarter revision meeting that discusses that after the fact, but since the report isn't even accepted at this point, that's correct, yeah. So we have to have a report that gets accepted first, and then there is a meeting that is called quarter revision, and that's where we discuss if there's concerns about the assessments are not correct and if corrections need to be made to them.
Yeah, it varies before 4 and 5 acres that you're talking about, and that's on the top of the hill.
Okay, I'm sorry, I'm not overly familiar with the property itself. So. Can we just get your name for the record?
I can't hear you very
Can
well.
we just get your name for the record, please?
It's Helen Elliott.
Okay, thank you.
Yeah.
Okay, so staff have made a note of that and they can pass those comments on to the engineer when he's reviewing this.
Okay, thank you
Okay.
very much.
All right, thank you. Down to 7.3, Amanda Stellings, Manager of Land Development, McPherson. Oh, this one here, is this the one that we're no longer doing tonight? I thought I had a letter saying that it was withdrawn.
I didn't see a letter. And this is part of this report coming up later on, is that all we mentioned?
Okay, so what I saw was a letter talking about the fact that there was, they were talking about
Well, withdrawing your request for a holding provision, that this is still in response to.
okay,
Yeah.
all right, thank you. Welcome, Amanda.
Okay.
Yeah, I'm the one that's confused.
Oh, it's all good. Thank you, Mr. Mayor, members of council. So Amanda Stellings, I'm the manager of land development at McPherson. McPherson, as you're likely aware, is the developer and builder of the Bridges and Seaforth development, which is directly adjacent to the Seaforth golf course. Through development of phases 1 and 2, McPherson did build the private road and services, which is McPherson Avenue. We had previously voiced concerns, which I think the holding provision you were speaking about, related to connection services. We understand that the applicant has demonstrated that they can service and access the property through front road now, and that the reports have been revised. So at this point, we just really wanted to reiterate that the road is private. It's a combined ownership between the Vacant Land Congo Corporation and McPherson. So we have no objections to the development that is proposed. We just want to emphasize that if there is a change of plan, that we would expect that the applicant would come forward and have a conversation with us about cost sharing of that road. So happy to answer any questions. I think you've got a letter from Lucian Nixon that speaks to that. So if there's any questions, happy to answer them.
Any questions from members of council at this time? Councilor McGrath.
More comment than anything, this condo agreement came from the fact that at the time, it was just about to be passed, that we would assume ownership of it. But they want to drive golf carts on the road, and you can't drive a golf cart on the municipal road. And I believe at that time, they decided to go for $1 million agreement, which, right, he's on the road and everything. He's maintained the facilities. So, but I don't understand the servicing, how are they gonna service the front road? Are you going on septics? Cause the person's own on all the underground services in the bridges. And if they're tying their sewers and everything on in there, there's gotta be, that's part of your letter anyways, it come to some kind of cost agreement. So I don't, is the front road more for traffic access or is it for like, where's the services gonna come from for this property? For water, sewer?
That's actually not part of this delegation, but,
Well,
this, Mr. CEO, did you want to comment on this? Or
Well,
leave
we
this
can
till
certainly
later?
wait till we discuss as part of the zoning application and you speak to the delegation at this time.
Yeah. Okay. All right. Counselor Fisher?
Thank you, Mr. Mayor, to, Amanda?
Yeah.
Sorry. Is McPherson amenable to providing a water and sewer hookup that would not be or be the same cost as going a quarter mile from the golf course to Front Road?
I think that would be a discussion. I have actually indicated today we're more than happy to meet with them and have a chat about what that would entail and how we can make it work, but it's just really recognizing that there obviously was an investment by McPherson at one point to build that road, so I think if that, the plan, my understanding is that the report that was submitted spoke to the access and servicing on Front Road, so if that were to deviate from that plan, then we'd be more than happy to be part of a conversation that looked at what that cost sharing agreement would be.
I don't think the golf course developer cares about your road. It's what's under it that you're very interested in going forward. So it makes no sense to me when something is right here, then you run something way over here. Cost, the environment, et cetera, et cetera. I would really, really like people to get along and everybody wins, but that could be passed on. Thank you.
Absolutely, thank you.
But in fairness, Counselor Fisher, we're not at that stage of discussion right now. Like Public Works is going to be involved in this. And McPherson's will be if there's a need for them to be. But if there is an alternate plan that that meets everybody's goals, then there may not be any need for that discussion. And then each would have their own private system.
They're both gonna end up going into our lagoons and our system.
Fully appreciate that.
So
And
wouldn't it be
once you
nice
get
just
past-
to have one?
once you get past the entrance to both McPherson's and the golf course facility itself right now, it is our system.
We could have a long chat about this, Mr. Chair, maybe another time, right? But
Councilor
anyway,
Strickland?
you
Yeah,
can
well,
pass
I-
that on.
Where I'm confused is that I've never seen a development after it's developed own the sewer and water. Normally, when a development is done and the first pavement is done, it's ours. It's ours to maintain it. If it breaks down, it's our water treatment plant. It's our sewer treatment plant. I've never, ever heard of a development owning the infrastructure forever. I've never heard that.
The and I don't even want to try and guesstimate. My understanding is with a lot of developments, it's when the top coat is down, it gets turned over to the municipality. I suspect that if something happened to the system that was in McPherson's development right now, and the sewer system had to be replaced, they'd be happy to turn it over to us very quickly. So
It just doesn't make sense that the system that someday is gonna be ours. And if it was ours today, for sure, we'd be saying, you're gonna hook up to here because it's a system that's only 16 years old that's going all the way to the lagoon right now.
and I certainly appreciate McPherson's position at this point, but I think we need to leave it to staff both from the planner's perspective and our municipal staff to come back with a report of where we actually stand and what decisions have to be made. And that'll come in the future.
We got similar water meeting or something.
Go ahead, Larry, last thing.
So you do have a registered condominium plan on the property now, correct? Like it's registered as a,
There's a portion of the land, so,
yes,
closer to where the golf course is. And then the remaining portion, so McPherson Ave actually would extend past what's built. And it hooks up to the north, so there's a chunk of it that's under McPherson's ownership. And there's a portion that the Condo Corporation, is managing.
and again, it comes back from the golf cart at the time, we had this discussion. And that's why the municipality could not own it, because it was either that or they'd have the golf cart right behind the houses, so they could drive to and from. So it was agreed at that time, so they can own whatever they want under the road. I mean, it'll have to fix, that's correct, but, you know, other than. I don't know, I just think it's registered as that property, so I don't know unless it's a legal thing, so it's as far as ever owning it. If it's legally registered as a condominium,
Anyways,
that's a legal question for.
yeah, certainly do understand your position and we'll wait till staff bring the rest of the information to us.
Absolutely.
Thank you.
Thank you.
All right, I'm gonna turn this portion of the meeting over to the deputy mayor. Here at 7.4. Okay.
All right, 7.4 on our agenda. Next up is a zoning bylaw amendment, Z08 2023. Shay, turn it over to you. Thank you.
Thank you, Deputy Mayor, members of council. Give just a second. Can you hear me?
Sorry, Deputy Mayor, we just need a motion to go into.
What that's for?
We just need the motion to go into the public meeting.
Okay, so it looks like that the council of the municipality, if you're to adjourn the regular meeting of council at 7:10, to go into a public meeting, discuss the following. Need a mover and a second for that. Councilor Morrison, Councilor Brown, all those in favor? That's carried. Thank you.
So this presentation will go over zoning bylaw amendment application Z08 2023. The subject property is located at 75836 London Road in Brucefield. The owner is Kyle Ford and applicant is Jay McGuffin from Monty Brown Planning Consultants. Both Jay and Kyle are in the gallery today and they wish to speak on behalf of the application. Next slide, please. So just for reference, there's also a corresponding consent application file C52 2023 that's been submitted in conjunction. Many of the details of the two applications are the same, so I'll provide a more in-depth overview now and speak specifically to the consent later in the meeting. So here's just an aerial of the subject lands outlined in blue. The lands are located towards the northeast of Brucefield within the settlement area boundary. And surrounding land uses include agriculture to the north, residential to the south and west, and immediately tucked into the southwest interior of the property is an industrial operation. That's GMCO trailers. Next slide. So for context, the related consent application proposes to create 3 new residential infill lots for an existing site parcel. 2 of the lots will be fronting on London Road and 1 fronting on Mill Road. The zoning application seeks to address the rezoning condition associated with this consent and is required to remove the holding zone from the description of the property, as well as to address site-specific provisions on 2 of the lots. Next slide. So here is the severance sketch provided with the related consent, and it outlines the 3 new lots to be created in gray. You can see that. Lot 1 is identified as the severed parcel consisting of the existing house. Lots 2 and 3 are to the west of this parcel, and lot 4 is located to the south, fronting on Mill Road, and it contains an accessory building and a solar panel. Next slide. So 2 special zones are being proposed as part of the rezoning. So the R1-43 zone applies to lot 2 and it will require a 20-meter interior side yard setback to the abutting industrial property. To address this adjustment, separation distance by the acoustical engineer. R1-44 will apply to lot 4, requiring a similar interior side yard setback of 20 meters to the abutting industrial property. And special provisions will also permit a lot frontage of 7.5 meters to recognize the existing deficient frontage on Mill Road. And will permit a maximum height of the existing accessory structure to be 6 meters, whereas the bylaw permits 5 meters. And lastly, it'll permit the existing accessory structure to remain prior to the main use being established. This provision is considered appropriate as the accessory building will be limited to personal use, such as storage, and is also used to house the wires and inverters for the solar. So this will allow the existing solar panels to be maintained entirely on the lot. Next slide, please. So here's the proposed zone map change outlining the different components of the rezoning. So highlighted in yellow near the top there is the portion subject to holding zone removal. The R1-43 zone is marked in green, and in purple is the R1-44 zone. These subject lands are designated as open and currently zoned R1 because of the bylaw. Next slide. So the Huron East official plan provides direction for residential development in secondary settlement areas such as Brucefield. Proposed development includes single detached dwellings, which is permitted in the R1 zone. And the plan also provides direction for low density development in secondary settlement areas. The proposal is consistent with the policies for infill and intensification and are proposed to be serviced with municipal water and individual on-site septic systems. So due to the proximity of the neighboring industrial property, a D6 road traffic and land use compatibility study was completed to address considerations of compatibility. This study identifies Jamco trailers of a type 1 industrial use and concludes that the observed noise levels associated are of an acceptable level and comply with Ministry of the Environment limits. So the study also recommended, as I mentioned, a 20-meter separation distance from the lot line of the industry to any residential development to provide some flexibility for the operation. Again, these apply to lots 2 and 4 and have been included as a special provision. Also note the study also suggests a warning clause be attached to any purchase and sale agreement, making future owners aware of potential for noise. The study was peer reviewed by GHD Limited, who have no outstanding concerns and concur with these suggestions. Next slide. So just for visualization, this shows for the 20-meter separation distance that applies. So those are the spots marked in dark blue, and the red boxes are potential locations for new dwellings. Next slide, please. So no concerns were received by neighbors or objections from hearing staff. MTO entrance permits will be required for the 2 new lots on London Road, and they have indicated support of the proposal, subject to meeting some criteria which the applicant has demonstrated and achieved, such as maintaining at least 30 meters distance from other entrances, and that the lot frontages on London Road be a minimum of 32 meters. County Public Works will also need to issue an entrance permit for the lot fronting on Mill Road, and have indicated no objection to the proposal, but did note that some traffic signs and trees may need to be relocated at the applicant's cost. Next slide, please. So it's just some photos here of the property for reference. On the left is the existing entrance. I'll note that the entrance is supposed to be realigned in order to fit the new 2 lots. And on the right is the existing dwelling. Next slide. Just a few photos of the neighboring trailer operation on the right and the existing accessory building with solar panels on the left. Sorry, hard to see. Next slide. And lastly, these photos show the frontage on Mill Road. So just illustrating the location of the street sign and some of the trees that may need to be removed. So with all that being said, it's recommended that zoning bylaw amendment Z08 be approved in the zoning bylaw amendment. I'm here for the questions and I believe afterwards.
Thank you, Paige. Do you want to hear any questions from council, or do you want to hear from the applicant first and then have questions?
Whatever works for you, maybe see.
Jamie Guffin, Monty Brown Planning and Sons, Principal Planner, and Vice President of Monty Brown. Working on this file with me was Eric Steele. Eric is on vacation this week, so I'm covering off his shift. So good evening. Thank you to council for having us here this evening. Just like to start by thanking Shay for her assistance through the planning and approvals process. It's been fantastic to work with. And we've had an opportunity to review her reports on both the zoning bylaw amendment and the consent. We concur and support her recommendations for approval of both applications. And I'm available here to respond to any questions of council or any questions that may arise through public conversation.
All right, thank you very much. Any questions from council? No, doesn't look like it. That's great. Good job. Thank you. Yes, thank you. So we carry on with this.
First of all, public meeting, then if there's no other comments from the public meeting would have to be closed. And
Okay.
then we go back into the regular agenda with
Okay.
the recommendation as part of the regular agenda.
Gotcha. Councilor Fitter.
Thank you, Deputy Mayor. For Shay, I had a question.
All right.
Thank you. How does Jamco access their property off of London Road, off of the entrance that exists now to the original house?
No, Jamco has their own individual entrance.
So there's
further
gonna
to
be two existing entrances and then two more.
yes,
the
there is
two
quite a distance between Jamco's entrance and with the
There's
existing.
no issues there with traffic when
No, so the traffic study was, analyzed as part of the D6 study and there was no projected increase on traffic.
Thank you.
Very good. Any other questions for Shay or applicant? All right, so then we want to go back into the regular session.
So, yeah, sorry, motion for adjournment for the public meeting and then back to the regular session.
Just want to make sure there isn't any public that wants to the application.
Any other people in the public tonight that wish to speak on this application? Before Jens? Okay, need a motion then to adjourn this. Councillor Deal and Councillor Willoughby. Anyone come to questions? All those in favor? That's carried. Back in regular session then. So is there a motion to be passed now, Jessica, or are we
Yes,
good?
you just go down a little bit further, number, the first item on 8.1 is the recommendation from the zoning bylaw amendment that Shay just overviewed for us.
That over. This is the motion here. We got it. Okay. Gotcha. Okay. I'll be looking for a mover or a seconder for it. I need to read the motion first. Get the motions on the other side. Whereas the council of the municipality of Huron East has held a public meeting pursuant to section 3412 of the Planning Act 1990 with respect to the proposed zoning bylaw 063/2023, and whereas no public comments were received on this application, and whereas no agency comments were received on this application. Now, therefore, pursuant to section 3418 of the Planning Act 1990, council concurs with August 30th, 2023 planning report and recommends bylaw 063/2023 be approved, be for approval. Mover second, Councillor Chartrand, Councillor Settler. Comments or questions on this motion? All those in favor? That's carried. Thank you.
That's it for that one. The next item is,
For the consent application then?
yes, C52, 2023.
Okay, there's a planning report consent application, C 52/2023. I need a mover and a seconder for this motion. I'll read that, or sorry, you're presenting that now, Shay, are you?
Yes.
Okay, sorry. I'll catch up.
Deputy Mayor. So yeah, the application C 2-23 applies to the same property at 75836 London Road. Again, many of the details are very similar, so I'll just keep the presentation brief and detail the consent details here. You're able to pull up my slide. On slide 4, the attached consent sketch illustrates the proposed lots. So the consent application seeks to create a total of 4 residential lots on an existing 14-acre parcel. 2 of the lots are proposed with frontage on London Road. Both of these are 1.56 acres in size. And 1 lot is proposed with frontage on London Road. It's the irregular shaped parcel to the south of the subject property and is 4.5 acres in size. This lot currently contains an existing accessory building and a solar panel. The severed portion consists of the existing dwelling and is 6.7 acres in size. So from a policy perspective, the application is consistent with the Huron East official plan policies for secondary and tertiary settlement areas, which permit infill development via means of consent and seeks to meet the goal of promoting development as a residential focal point of the surrounding agricultural community. These lots all meet the minimum size for a partially serviced parcel and provide ample room for a septic system. In this case, a nitrate study was not required as the lots are all large enough to be exempt as per Huron County's terms of reference. And the G6 study detailed in the rezoning presentation was required with this application, and the suggestions from this are addressed within the new zoning provisions. Again, no neighbor objections or concerns concerning the staff. Both County Public Works and MTO will need to issue permits for the respective new lots, and both agencies have no objections to the consent. If you're able to go to my very last slide, Jess, I just detailed some of these conditions. After the last one again. So it's a little hard to read here, but condition 10 and 11 stipulate the requirement for entrance permits from MTO and County Public Works respectively. And condition 12 at the very end also requires that a draft reference plan to MTO be submitted for their review as per their request. A few other conditions to note is condition 4 related to cashing in the parkland fees. These apply to each lot created, so the fee is $2,250, so 3 times the municipality's fee of $750. And condition 7, 8, and 9 specify the required zoning amendments addressed through the concurrent rezoning application. So as this application is consistent with the PPS zoning bylaw and Huron Eastern County official plan, it's suggested that the application be recommended to the County of Huron for approval with the attached conditions.
Any questions, council, on Shay's report? None. A motion here, I'll read it and look for a mover or seconder on the other side. Applicant didn't have anything else this.
My comments stand on previous. Thank you.
Perfect, thank you. That the Council of the Municipality of Huron East acknowledged the report of Huron County Planner Shay Stoll dated August 30th, 2023, and has no objection to the consent application C-52, 2023, provided the conditions as outlined in the planning report on that. Looking for a mover and seconder for that. Councillor Dalton and Councillor Fisher. Comments or questions? All those in favor? That's carried. That other motion that after that then too, Jessica?
No, now it goes on to a different consent application.
Gotcha. Okay.
It's 0.3.
Great. Go ahead.
All right, this one is for the file C 53-2023. It applies to 44056 8 Michaels Road, and the owner and applicant is Madeline Stice. Next slide, please. So just an aerial photo of the subject property, located just southeast of Cranbrook here for reference. The purpose of this application is to recreate the original 100-acre farm parcels. So outlined in blue there is proposed to be severed, and outlined in orange will be the retained lands. Currently contains a dwelling, a bank barn, and several sheds on the retained there. Next slide, please. So as I mentioned, both parcels are approximately 100 acres in size. The few buildings existing on the retained. Subject lands are zoned general agricultural and natural environment, and designated agriculture and natural environment condition official plan. Next slide, please. So the application meets all the applicable agricultural acceptance policies. The new configuration results in 2 lots that are the same size prior to inadvertently merging. Both lots will be continued to use agriculture, and no changes to the current farm operations are proposed. The proposal here is being requested to facilitate farm succession planning for family. Next slide, please. So no concerns or comments received from staff and other agencies, and Maitland Valley Conservation Authority has no concerns. Next slide, please. So as the application is consistent with the PPS and conforms to the drainage plan, the county official plan, the application is being recommended for approval with the attached conditions. My next slide details the conditions, nothing to note here, pretty standard conditions for this one. Here for any questions on that one.
Yeah, order. This one.
It was just a consent application, so there's a question from council that
Are there any questions from members of council this time? Seeing none. And can I get a mover and a seconder, please? Moved by Councillor Steffer, second by Councillor Newell. That the council of the municipality of Huron East acknowledge the report of Huron County Planner Shady Stahl dated August 30th of 2023, and has no objection to consent application C-53 of 2023, provided the conditions as outlined in the planning report are met. Comments or questions? All those in favor? And motion carries. We go on to planning report Z01 2023.
This is my last one for the night. So this application addresses the zoning of Z01-2023, applying to land in the known One Blue Drive and owned by the Secret Golf Course. The next slide here shows an aerial map of the subject property with the site subject to rezoning outlined in red. The corresponding official plan amendment was approved at council back in May of this year and approved at county council on June 7th. This was to include the identified lands in the urban settlement area. The zoning application here was deferred at the May council meeting to allow time to address concerns related to access and cost sharing of infrastructure. Next slide, please. Just a bit of a closer look at the subject property. I'll try and keep this presentation fairly brief and just related to the updates on access. If there's any details from the corresponding plan amendment or previous zoning presentation that you'd like reminded of, just please let me know. And next slide, please. So the zoning application proposes to change the current golf course zone to a R3 special zone. As mentioned, the OPA was approved back in May, and the related and deferred consent application from 2021 to separate identified lands from the golf course has also since been recirculated and will include some conditions related to service at that time. Site plan control and or plan of condo application will still be required to facilitate development on site. And next slide, please. So the R3 special zone here includes a few site-specific provisions, which have changed slightly since the original public meeting. The site will still be limited to row house dwellings and will permit a rear yard setback of 2.5 meters. This is to recognize a deficient rear yard for one of the proposed buildings on the east side of the property. The provision to permit a 3-meter separation distance also stipulates the standard condition between the buildings, and the final provision listing is to provide direction for how certain provisions will be applied at the time of site plan, as well as when building permits are issued. Next slide, please. So the main outstanding concern from the original rezoning public meeting was concerns related to access, location, and the cost share of infrastructure. The original access on Front Road was proposed to the east side of the site, which led to some outstanding concerns from the peer reviewer. Since the May meeting, additional traffic memos were provided outlining further sightline calculations and expected traffic generated. The updated conceptual plan proposes a new entrance location onto Mill Road, which is further to the west, approximately where the existing maintenance access is located. The updated report also concluded that where the existing development could be serviced by a single access point on Front Road, removing the need to share access with the neighboring bridges development. The municipal peer reviewer has confirmed that the new location would be appropriate based on sightlines and traffic conditions. The final comment letter from the peer reviewer has been included in capital materials for more details on their comments. Next slide. So here is the revised concept drawing showing the location of the single access point with a turnaround on either end of the development. The drawing also reflects a change from 62 to 64 to 62 townhouse dwelling. Next slide, please. Here are just a few photos showing the approximate location of the new access with an idea of sightline conditions on either side. And some more photos of sightline around this location a little bit further to the west. This traffic study also identified that a few trees will need to be removed within the site triangle. The peer reviewer concurred with this suggestion, and this will be included as a future condition in subsequent planning approvals. Next slide, please. So no further objections or concerns were received by any agency or staff. Members of the public who participated at the last meeting were provided with an update addressing their concerns. And the proposed rezoning has considered comments and outstanding concerns received at the original public meeting and sufficiently addressed concerns related to access and cost sharing of infrastructure. So it's recommended that zoning bylaw amendment 01/2023 be approved and the implementing bylaw passed pursuant to section 3417 of the Planning Act. I believe Caroline Baker, the applicant planner, is online, just listening in, but I'll try and answer any questions.
Yeah. Any questions of council at this time? Councillor Fisher.
Thank you, Mr. Mayor, to share. The distance from the new entrance to this development to the current entrance, I don't know what it's called, Joy Drive in the person,
McPherson Drive?
whatever.
Avenue?
Yes. How far? What's the separation, please?
It's quite a far distance. I don't have the exact number. I would say it's a few hundred meters separating those two.
200. Okay,
That's from Craig Nice property.
that's my next question. Is it directly across from any access on the south side to farms or houses?
I don't believe so.
Thank you.
Any other questions? Deputy Mayor.
Thank you, Mr. Mayor, through you to Shay. Shay, is there ever a concern with just one entrance into a development like this, like in case of emergency?
From an emergency access, the details of that will be kind of discussed when we do a site plan, but as far as meeting the criteria for sight lines, and there is adequate access and those turnarounds for fire trucks.
Right,
That kind of
but I'm thinking more of what if there was an accident at the, at the entrance, and they can't get anybody else in, because it's only one way in, one way out. It's
Right.
more what I'm thinking of. Like, I like the way it's laid out, but it's just, if there was ever an emergency right at the gateway or in that laneway into that development,
Yeah, I suppose that would be a consideration that needs to be considered at this time too. We might look at having some sort of emergency easement in that case, but I will note that and pass that along to the planner and consider that.
Mr. CAO.
It's not uncommon for us to have subdivisions where we've got what I would classify as sort of. Certainly the pole subdivision is a good example of that. There's one it's in there, right? Right, so it's not uncommon, right, it's not a necessity. In this case, it would be, you would say there's a car accident, let's say at the intersection there for whatever reason would restrict access for a period of time, but it wouldn't be for any extended period of time.
There is actually an emergency entrance into, the pole subdivision at the back through the field.
Yeah.
No, actually, there's one from the arena. There is a small paved spot. It says no vehicles other than emergency vehicles only. Everyone uses it for a walking path and a bike path. But really to have one of those off of the top loop there, maybe even up to the parking lot for the golf course would be an easy fix. Yeah. You're only talking 20 or 30 feet.
That's right. Yeah, no, I just wondered, that's all. Thank you.
Is there more, Steve? You're done. Any other questions of council at this time? Okay. So, all right, so I need a mover and a seconder, to approve the zoning bylaw amendment. The bylaw itself would be read at a later time. Can I get a mover and a seconder, please? Moved by Deputy Mayor, second by Councillor Stefler, that the council of the municipality of Huron East approve zoning bylaw amendment Z01 2023, and that the implementing bylaw 037 of 2023 be recommended for approval pursuant to section 34, paragraph 17 of the Planning Act 1990. All those in favor? And motion carries. Thank you. We are down to municipal drains. I have none listed here. Reports and recommendations of municipal officers. See, connecting link. Barry's got a report in there. Are there any questions for Barry at this time on that report? I don't think there was anything to highlight on it unless, okay. Can I get a mover and a seconder for 10.1? Councillor Morrison, Councillor Newell, that the council of the municipality of Huron East authorize the mayor and the clerk to execute the winter maintenance services agreement from Integrated Maintenance and Operation Services, Inc. Operating under the name of Owen Sound Highway Maintenance Limited at a cost of $7,192.48 plus HST for the 2023-2024 winter season. Barry, just one question. Like, I realize a lot of things have gone up in price in the last little while. It looks like it's about a 50% increase since what, about 2018 or something like that? Is that pretty common to all your neighboring municipalities for prices they're paying?
I haven't actually checked the neighboring municipalities connecting link programs as far as cost, but I can do that, but I would think it's pretty consistent because it's the same company providing the service to all the connecting links in this area.
Now, do we use them for both roads or just the one?
Just the one. The connecting link is just number 8 from the Centennial Drive out to Purdue Harbor A.
This is county.
And we don't pay them 3 times.
Yeah. Okay. Any other questions of council? All those in favor? Motion carries. 10.2, Vanastra Early Childhood Learning Center. I'll get a mover and a seconder for the motion first. Moved by Councillor Fisher, second by Councillor Deal, that the council of the municipality of Huron East approve the following Vanastra Early Childhood Learning Center policies regarding medical appointments, classroom rotation, drop off and pickup, vacation, cold weather, diapering and toileting, inclement weather, risky plan, and sun, heat, and air quality. Comments or questions about the information that was included in the package policies? Seeing none, okay. All those in favor of the motion? And motion carries. Thank you. Municipal debt limits. I think I'll let staff have a discussion before I take some names on this one. I thought it was a very good report. It was good that you asked for it, Councillor Chartrand, but I think it provided good information. Go ahead, Stacy. It was pretty thorough already.
I think we've had a lot of talk about debt reserves and capital purchases for the past few months. So this, I guess, just focuses on the debt. So the advantages of the debt are the distribution of the benefits and costs of infrastructure more fairly to taxpayers who benefit from the actual infrastructure and certainly so over time rather than having tax spikes and dips. As well as ensuring the funding of urgent capital projects when other sources of financial support are not available. However, excessive debt can compromise financial sustainability and flexibility. But in our case right now, our debt level is extremely low. So I don't think we're at any risk at this point. From an overall strategic financial plan, debt is a tool that, if used properly, can provide sustainable funding for capital purchases. In conjunction with taxation revenue, grants, and user fees. It is important to reiterate that part of our long-term 2023 financial plan, all of the tools available to the municipality to support capital expenditures were used, including debt, and that the municipality has not been contributing sufficient dollars to reserve to support future capital needs. Without the use of debt to fund the capital needs, the municipality would require significant taxation revenue. I'm going to go on to the municipal debt limit calculation. So this is a calculation that is done every year by the Ministry of Municipal Affairs and Housing, and it is to be presented to council every year as required by the Municipal Act. And this report provides council with information with respect to the municipality's existing levels of long-term debt, as well as additional long-term borrowings that could be available as per provincial guidelines. So the provincial ARL provides for annual debt charges that are no more than 25% of net revenues fund reserves. And we'll go over that, the calculation, so you know where that number comes from. The municipality ARL, as well as the municipality's ability to repay debt, are carefully considered when staff present recommendations on debt financing to council. And just, you know, the provincial ARL is a similar principle to personal debt. Like when you go to the bank, they're only going to give you so much that they can fund based on your annual income. So that's the same principle the ministry guideline provides to us. So the municipality of Municipal Affairs and Housing determines the ARL on the second previous year's financial information return as prepared by the municipality and submitted. So we're looking at the 2021 figures in order to calculate our 2023 debt limits. And the municipality's annual repayment limit represents the maximum amount that the municipality has available to commit to additional payments relating to debt and financial obligations. So this is the amount that we can actually pay annually towards debt. So if we're looking at the calculation, I don't know if you can pull that up or if you all can look at it. I'm looking at this. You can see for our repayment limit for 2021 was calculated at $3,193,291. which, and they have illustration purposes here, equates to, depending upon the number of years and the annual percentage amount, anywhere from 13 million to $39 million of debt or additional debt that the municipality can take on as per the ministry. So if you look at the second page, it shows you how the calculation occurs. So the first section is our actual debt payments in 2021. So we had debt payments of $99,045 in 2021. The second section, they remove certain specific types of debt payments from the calculation, and in our case, the only one that is removed is for tile drainage loans, and we just had one of $870. So our net debt charges for 2021 were $98,175. And then to calculate the revenue for the purposes of their calculation, they take our total revenue and they subtract the fees for tile drainage loans, which obviously offset the debt payment above. Any Ontario grants, Canada grants, deferred revenue, revenue from other municipalities, gains, losses on sale of capital assets, which we didn't have any, to get down to what they refer to as our net revenues. So our net revenues, so our own revenues, it's basically taxation and user fees. Was 466. And then they take away current debt we have, so our additional debt repayment limit is the 3.19 million. So that's what we additionally can have. So since that is, right here, 2021 calculation, we have to kind of put that into 2023 terms because this would be for a 2023 budget. So we take our 2021 net revenues, so this is back on the report. As per their calculation. So that's the total net revenues, the 13,165. And then we take 25% of the net revenue fund, which is the, sorry, I'm doing that wrong. I skipped a part. I need to go back. I had a chart to compare other municipalities. I skipped ahead by accident. That one right there.
Stacey, can I, without breaking your train of thought, can I ask you a question? I thought this information was really good to see the comparison, how we are compared to our neighbors. We're certainly the second lowest in the county and way under some of our neighbors. But what I did see, which would have been really nice to add, was if you did this same chart, but but did the calculation after, and where was that page? Where you're showing projected debt balances.
Okay.
If you had taken that number, and you would have had to exclude the one where you've got roads equipment, which it's internal to begin with. So there'd be no debt debenturing on that. And not necessarily that all these would, but let's assume worst case scenario, we borrowed the money from the government for all of them. What percentage would we be at that point to compare to our neighbors? I think that's really the question that has been asked over and over, is that they want to know where we're going to be down the road.
Okay. Yeah, and it's hard to compare like today's neighbor to the future Huron East.
I understand that. I'm only looking for our future monies compared to today's neighbor.
And I think I did that online.
Did I miss that somewhere?
There's this page.
I think there is a chart on that.
The next page, so there we go. I think here, Stacy put together kind of a chart showing where percentage would be as we go through the years. Based on our 5-year capital plan. So we'll see that we'll get 4.39%.
Okay,
So yeah, 110.
Yeah, that's our highest.
Yeah, so 4.39 is kind of the highest point will be, and that's when we basically borrowed all the money for the 2023. Now we're in a debt payment period, those borrowings. And then as time goes on, we're going to reduce them because some of them get paid off over time. That's kind of going to be your worst case scenario is that 4.39. So if you put that 4.39 back in that table, that shows where everybody is, assuming that nobody else, no other municipality borrows money in the same time period from 2021, you'd be sitting above the middle of the pack.
so we're basically sitting right with Central Huron, Blue Water, all of our existing next door neighbors, really.
Yes.
Yeah, and that 4.39, just to note, does include that $170,000 for that 1 year payment. So I included all debt in the calculations, just so that we were looking for considering every type of debt that we were entering into.
So if I'm correct, Councillor Chartrand, that's really the question you wanted to know, was that if we borrowed all the money that we had talked about in the future budgets, where would that leave us at the end of the day?
Yeah, and it was a good report, the part that caught my eye on the whole report. Her first chart shows, prior to December 31st of 2022. The current balance of debt that we actually have today is 1.4, call it 1.490, rounded up. After we do our 2023-2025 budget, our debt for that, if we spend all that money on all the items that are listed on there, our debt is $4.5 million, which puts us at a total of $6 million in debt. So if you look at where we ended up in December 2022, we're only at 1.5 in debt. Period. Now we're gonna be close to $6 million in debt. Based on what we budgeted in the new 2023, 24, 25 budget. Correct. Our forecast, right?
Right.
That was a real eye opener for me because I never knew how much debt we had prior to our 2023 budget. And the real eye opener is how much we're going to take on over the next 2 or 3 years.
Right. So, and I'm not gonna remember all of them off the top of my head, but, I'm trying to think of all the things that we have money borrowed for now, but,
It's on that
the medical
first chart.
center and,
It's on the first chart.
Main Street and the family health.
yeah.
That's it, as far as I know.
And I don't think we ever borrowed money to pay for equipment before.
No, but we didn't put enough away for it either. That's kind of the problem.
That's why I did the new budget
Yes,
system.
yeah.
Just to add on to that, I don't know if you noticed, there's no borrowing, like on that chart that you're pointing out, there's no borrowing forecasted for 26 and 27.
No, it ends at 25.
Yeah. So, I mean, that doesn't mean that it's not gonna happen, but right now,
And necessarily, when we get to the 2024 budget, 2025 budget.
Yeah.
We may not spend that money that we forecasted. We might defer it out. We don't know that right now because we haven't got quite that far yet.
That's correct. And if I can go back and reiterate what we talked about at budget time was that budget was worst case scenario, assuming we never got any assistance from the federal or the province or whatever. So if we get any of those grant programs or anything between now and then, we could deduct those grant amounts right from what these borrowing amounts would be if in fact that's council's decision at the time. So again, this is still worst case scenario based on all the information that's available to staff today to give to us.
But the chart, the information that you provided, Stacy, is great. It shows everything that we did borrow and what we potentially could borrow in the future. So thank you.
and you're welcome, and you'll see this now every year going forward. So the ARL comes out in March, so that's about when.
Are there any other specific questions that anybody had for Stacy at this time? Can I get a mover and a seconder for the report, please? Moved by Councillor Chartrand, second by Councillor Morrison, that the Council of the Municipality of Huron East received the report for information purposes as required per the Municipal Act of 2001 as amended. Financial, FIN 23-08. What's the FIN?
That's the next report number.
Oh, sorry. Oh, just as amended was the end of it.
That was the end, yeah.
Okay. All in favor?
Sorry, Mr. Mayor, I had some comments.
Oh, sorry.
I didn't realize
Okay.
we're going this quick. I'll try to be succinct. I didn't. This report was very thorough, but I didn't like the report. I thought the report presented debt as a way of life, and I thoroughly disagree with municipal debt. I realize we may have to have some, but I don't think we have to have as much as is being proposed. And as Councillor Chartrand referred to, we're gonna go up to 5.5 million real quick. And nowhere in the report does it tell us how much that is gonna cost us in interest over the length of these debentures / loans. I think that should be part of the report. I don't like the 10% either. Assessments are gonna go up, more building in here on East, etc. That amount could grow considerably. So I would like to defer this until we get more information on how much we're gonna pay over the length of these loans. And is there ways, as we did with building the family health team, to use internal funds instead of having all this debt? And to compare it to other communities, I don't bite that. To me, that's here or there. It's what we do ourselves. So I would ask that council defer this until we get the information I asked for, and that we look at maybe a cap on how much we borrow instead of a percentage. Or if that's not the case, reducing the percentage to 5%, please.
Okay, so just a couple things, Bob. This here was a report just for information because of a request of council. It's not authorizing anything. There is talk later on in the agenda about actually making a borrowing policy that council is to have a discussion about and wanting to set up the terms.
Well, just remember everything I said then for that.
Okay.
I thought that's where we are. I thought this was all one in.
No, it's separate things. This is just the information that was requested that Stacy has brought forward. And just to clarify one thing, although, yes, there's been talk that this may be borrowed from the government as a debenture, as we've done in the past, with some of the loans. It is written on there that it's to be determined by council when we get to those loans, whether council borrows from the government or whether we want to do internal, if internal is available to us. So that is already laid out in Stacy's report. It's not determined already that we are going to debenture with the province.
I had a lengthy discussion with Stacy about this morning, and I listened to this several times. I guess I missed those points, but I still got the impression from this report that debt was a done deal and we're gonna have 5.5 to 6 million going forward. Okay. That's how I interpreted it. Thank you, Mr. Mayor.
Okay.
Thank you, Stacy.
Brad, did you want to comment?
I just want to comment on the fact that regardless of whether we borrow internally, we're still going to be paying an interest payment because we borrow from our existing reserves, which is really only our utility reserves. And not sure we have the capacity to borrow that much from them anyway. They're going to all be in that same percentage because we have to give the investment, those reserves have to be returned. You can't just take the money and not pay the investment return. So we're still going to pay interest on those regardless. And I guess, you know, I respect the councilor's concerns in terms of borrowing, but in terms of our long-term financial strategy, this is the step we've got to take at this point in time in order to be able to sustain the infrastructure, your existing infrastructure, because we haven't put money away in reserves over the past. And so we've gotten to ourselves to a position where we're kind of pinched. We can't keep deferring some of the capital purchases we're talking about, because we're talking about maintaining existing levels of service. And that was why it was pretty critical for us when we brought that financial strategy out, was to show you over time, at least at this initial year, we're borrowing for that sort of, for those critical pieces. But going forward, we'll start using our reserves that we're contributing from taxation to be able to fund those capital programs. So we don't have to borrow again unless it's an initiative that council wants to go forward of. And I've always used the example just because it's, you know, it's something that might be a new initiative someday you might think about, is if you wanted to build an indoor soccer complex, let's say, right? That would be a new initiative that you might get some federal and provincial grant money for, and you might get some donations made for it, and then the municipality would contribute to it. And that's where we might go out and borrow money again. But the only project that's going on beyond 2023 was in our capital plan. I was talking about doing some work to this building in terms of particularly kind of renovating the third floor and kind of making it more use. You guys don't have to go forward with that project. We don't even know if we can maybe get grant funding. That was why we kind of put it off from 2023 to 2024 and 25, was the hope that there would be grant opportunity out there. And there are grant opportunities out there. Carolyn's been keeping me, you know, fairly well informed of what those grant opportunities have been. It's finding the right one that gives us the biggest bang for our buck, right? We're looking for at least 50 cents on the dollar type of grant opportunities, opposed to, you know, some pittance of dollars. But at this point in time, I know Stacy's included it's roughly $1 million to do work on this building as part of your debt plan, but it doesn't have to be you don't have to incur that necessarily. There could be lots of things that could happen between now and then, as the mayor said, in terms of grants. We could raise taxation, to get that extra dollars if that's what you want to do. So I think this gives us a really good financial strategy. I know councils will twitchy about debt, but at the end of the day, we're trying to emphasize to you that your debt level is very manageable. It's very respectable, and comparing it to other municipalities was to give some perspective. It's not that we're trying to say, well, Bob's doing it, so let's go borrow some money. It's about trying to give some perspective of what everybody has to do. And the provincial government is basically already has a large amount of debt. And so they're basically saying they're not going to give you money unless you're using all the financial tools that are available to you. I've been sitting across the table from the Minister of Finance, not with you guys, but within the municipality, where he said, you have debt capacity, you're not going to get any money from us.
I'd like to share one other thing before we move on. Deputy Mayor is well aware of this. So at the county, there are some major projects coming forward. The one building that we're talking about in the town of Goderich, $20 million taxpayers' dollars, 100% taxpayers' dollars from the county. At the moment, none of it's funded through the province of defense. We're talking about major expansions to the public works yards in the north end, which do need to be done. There's no doubt about it. Council spent 3.5 years going over it, site visits and everything else. The work needs to be done for sure. Anyways, I was really frustrated with some of the things that were going on, and the fact that they were talking about borrowing all this money. We had, what was it, $60 million in reserves or something like this, and they wanted to borrow the money. Now, I can understand from the treasurer's point of view. He is always going to feel better in front of council or whenever there is an emergency, if he's got a big pile of money sitting there and say, hey, we can draw on this, we can do whatever. I was always opposed to that, because if you look at the cost of inflation over the period of COVID, we lost at least 10% on the value of our money that had been sitting around for years just over that short period of time. So I spent a lot of time with Mike before his report ever came to county council. And I'm talking 2 months before, when he started working on this. Mike's report was extensive. He talked about a lot of different scenarios. And at the end of the day, whether everyone wants to believe it or not, and I'll tell you, I have a lot of faith in Mike's work. It doesn't really matter whether you had the money in the bank or you borrowed the money. It came out as a wash. And I mean, scenarios can change a little bit from week to week to month, but he ran a lot of different scenarios to say what ifs. And in most cases, it either went 0.1% in one favor or 0.1% in the other way, in other direction. So my idea has always been, you should have reserves for three things. One, if you have reserves for things like, you're planning on building a bridge in 3 years and you know that you're gonna have to put most of the money to it. If over a 3-year period, you're gonna put a third of it away each year so that you can meet that obligation, to me, that's good management. Yes, you should have some money set aside in case some emergency happens. Whether town hall burnt to the ground and we had to make some sort of other emergency plans, or some other disaster happened in town, or a winter hit us that our snowfall budget just wasn't going to cover it, we need to have access to funding to take care of that. And I forget what the third one was, but I always have three. But the bottom line is, I don't think there's any merit in having millions and millions and millions of dollars sitting around that you never use, because they depreciate every year. Now, the other way to look at it is you get interest on that money and you lose value on that money because of inflation. And that's where the whole thing came out. And based on what the province lends money for, it worked out so close that it was really hard to ever justify having huge reserves amounts. And if you need to do something, borrow the money at that time and pay it off over time, because it doesn't cost you any more than if you'd been saving the money for years. So there's a lot of things to take into consideration. And I understand, Councillor Fisher, that it's not always easy to see it that way. And I certainly had a different opinion. I thought we were better off always spending the reserve money and not borrowing as much. But Mr. Blumhagen did convince me with his facts and figures, and he presented a lot of good information that at the end of the day, whether you finance it now or finance it later, it really comes out in the end. And there is some merit to financing it later. And I don't remember whether it was in this report or the other report that was written about how we do it, where you talk about the BMG, where yes, we may be doing that over the next 20 or 30 years, but the people that are using the facility over the next 30 years are also paying for that financing. So there's a lot of merit to that too. And when you take into account its future dollars that are paying the money back, the future dollars are worth more than the day you borrowed the money also. There's just so much that goes into these calculations. But I am truly convinced now that it's 6 of one, half a dozen of the other, of which way you want to do it. And I still think you're always safer borrowing the money when you need the money, instead of asking the taxpayer for it today, not knowing when you're ever going to use it. Okay. You had a comment, John?
Yeah, that's great. For two type of assets, appreciating and depreciating is what you're borrowing the money for. And I'm looking at, 5% interest rate on the project. I still don't see any land. I don't see any, where we're going with this outside of, equipment. Well, that's a depreciating asset. So you're better to use your money today than to borrow it and add interest on top of it. So I get what you're saying. But it all depends about what asset you're investing in, and that's why the municipalities look different on a spreadsheet than in actuality.
I agree, and that should always be a discussion of council every time they decide to debenture, which is the proper course of action at the time. Correct. Absolutely. Did I call the vote? Yes, I already did. I called the vote. Stacy, thank you very much. I thought it was a very thorough report.
Okay,
Was there anything specific you wanted to still add for council?
no, as long as, does anyone have any more questions, because there was a lot of information in there. Wanted to make sure.
That's why I thought you answered a lot of it ahead of time.
You got called.
Did you want me to go on to the next one?
Yes, please.
Sorry. So this is the policy, I think that Bob was referring to. So as part of I'm recommending that the council of the municipality approve this policy. So in order to have a sound strategic financial plan, it is important to have the proper policies in place, and a debt management policy is one of those policies. So if we're going to look at an overall strategic financial plan, A debt management policy is a piece of that. There's quite a few policies that fit into that. I'm sort of looking into them and hoping that over time I can develop it and do a cohesive plan. But this is an important one, and I put this out today because debt has been a hot topic. The policy is our guide on how we're gonna manage our debt. And it establishes objectives for debenture and other forms of financing necessary to meet the municipality's capital requirements. So the strategy laid out in the policy is to set a limit to the amount of debt that can be authorized that is in line with the municipality's capital needs over time. So the ministry has a 25% limit. The policy is recommending a 10% limit. And I compared this to several other policies with municipalities in our area, and 10% seemed to be a common level. If you look at the chart on my report, and we can just look at 2023. So that came off the previous report, the net revenue for calculations from the ministry. And 25% of that was the 3.9 million. So that was the annual repayment limit. But if we adopt this policy, our annual repayment limit would be 1.566 million. That's a maximum that we could go up to as a municipality. And then with that calculation, if we had a 10-year debenture at 5%, or all our debt was 10-year debentures at 5%, as per the ministry, we could borrow 30 million. At 10%, our policy would set the limit at 12 million. Just for the So this is an efficient and effective use of debt, or the efficient and effective use of debt is recognized as an important component in the acquisition and deployment of critical infrastructure and other capital requirements. So this is a necessary policy in order to build a strategic financial plan for the municipality, as I already mentioned.
Councillor Chartrand?
Yeah, just a quick question. So,
Yeah.
well, I understand it. So the 25% is what is the max the government says you could borrow?
That's the max that we can have as an annual repayment,
Repayment, not borrowing,
not borrowing,
repayment.
repayment.
Okay, that's the difference.
Okay.
Okay, thank you.
You're welcome.
Councillor Fisher?
Reiterate what I said earlier. Mr. Mayor. I would like to defer this. So we can have a report on how much interest we would be paying at the proposed rate. As it stands right now, it sounds like it would add the payments, be it 10 years or 20 years, would add at least 2 points to our taxes every year. 80 some odd thousand is 1 point, I think, on the last budget discussion. So the million or the 100 and whatever it was, or it was over 2 points on our taxes. I don't like 10%. I could live with 5 and maybe a maximum on that 5. And just to get back to a comment Mr. McRoberts said about paying interest. I would rather pay interest to the Seaforth Development Trust or the Brussels Trust or the Water and Sewer than to CIBC and some big building down on Bay Street. I'd like to keep it local because that money will just get spent in the community.
Go ahead, Steve.
So this policy allows for you to choose where you want to make those loans, and
Yes, I realize that, but Mr. McRoberts' comment sounded like he wasn't interested in doing it.
No, that's not what he said, Bob.
Well, I'm sorry, that's how I heard it. Sorry.
Okay, no. What he referred to was the fact that we don't have a problem. We've never had a problem borrowing from ourselves internally when the funds were available. But because of some of the projects that we're doing to balance things out over the next 2 or 3 years, there may not be enough internal funds available to us to debenture them all internally. So we will look at it and then make a decision whether it's makes more sense to do it internally or to do it through the province or some other need. Councillor Stephanie.
Yeah, again, bear with me here, I'm new on this project here, but we have to approve everything anyway.
That's correct.
So are we just creating a policy to have a policy? The government, the provincial government has already set limits. We're well within them and actually well below them.
Right.
That's fine, but nothing can be spent without us having a majority on the project anyway.
Correct.
So numbers are numbers, deferring this and really irrelevant. I guess you could just say provincial standard. And then we have to say if it's a good, financial decision or not. That, I think we're making policies on top of policy.
I can speak to that.
Yeah, okay, go ahead.
I just want to make sure to understand, council, we're trying to set this 10% policy so that when we're looking at long-term financial plans for you, and when we're considering projects and developments that might come forward, we know what the limit is based upon what this policy says, right? So we don't come to you because forget about any other project, but we might have some fairly substantive sewer projects coming up in the near future, which will use up the remaining amount of that debt capacity. And so we've got to look at those projects from a standpoint, how much debt can we sustain before we hit that sort of what I'll call an operational threshold from a staff perspective on how we design our capital plans. Okay, so it's a value to us, maybe more so than what you're thinking from a staff perspective, to have a limit set so that when we put long-term financial plans together for all our assets, water, sewer, because they're included, right, even though they're separate user paid systems, we know how we can spread those capital debt plans out. So Mr. Mills over there knows the fact that, well, if he wants to go and do some project, right, we're going to try and keep it below 10%. Unless, of course, council makes a decision that they say, this is a priority, we want to do it now, we're going to go over our policy limit.
Right, and that's I guess exactly where I'm saying thing is, we've got our limit set for us.
Yeah, provincially.
The project there, you guys as an administration who we trust and respect, say we're gonna work on a 10 threshold a year.
Yeah, that's.
But I'm in a point of making policy just to hear ourselves policy.
Yeah, but from a staff, well, most policies give staff direction. That's really what comes down to, right? So that's really what we're looking for here.
I would also add one other comment to it is that since we're kind of turning the page on the way municipal government operates, because it used to be municipal government would never consider ever borrowing money to do projects, but they're all forced into doing it now. That if you get questioned by the public about, how much debt are we going to be taking on? Are we going to be like the province or the federal government or whatever? We can talk about the fact that the province has set guidelines to make sure that we can't overspend, and we're not even getting close to what they've set as their guidelines that we've set for ourselves. So we've set a policy so that that policy is in place to basically safeguard the public to be aware of the fact that if we decided to ever go over that policy or change that policy, it would be news again that would get out to the public.
All right, yeah, I'm all good. I think we're mixing up the word guideline for policy. We have guidelines and areas around there. That's what we're going by, we're protecting you. But again, I'm all good with either. We're not gonna hit that threshold. We're well below that.
Yeah, and in fact, Stacy, if I remember correctly from the numbers I saw in your report here, if we did the maximum of everything we had talked about here, we actually wouldn't even get to the 5%, would we? It's at 4.39.
That's correct.
Yeah, and that's everything that we're talking about doing over the next few years before we're actually starting to build our reserves back up.
Right.
Unless, of course, you get into any type of large capital capacity projects for the sewer project.
Correct.
They're not
But
gonna
again,
get
this is
that-
like,
that sort of radar there. They're there, but we don't know when they're gonna happen.
Right.
Mm-hmm.
That'll be discussion for tomorrow.
Yes.
Be prepared, Terry. Anything else you want to add at this point, Bob?
No, I'm a little surprised that when you're talking millions of dollars, there's 1, 2, 3, 4, 5, 6 who have no comment on this. Either they're very happy or they're not concerned. Surprises me, Mr. Mayor. I was going to ask for a recorded vote, but I think it's a done deal. So I've got no support on deferring it. I would ask so going forward, please. If we could get a report on exactly how much interest this 5.2 5 million is going to cost us and how that will impact our taxes for the 10 years or whatever term it is, please.
The only problem with that, Bob, is because we haven't decided to borrow the money.
I'm sorry, I'm gonna get Mr. McGrath
Okay.
at WD 40.
Since we have not decided to borrow the money, we don't know what the interest rate would be if we did go and borrow the money. Because those rates do change fairly often. So we can ask staff that if council is about to make a decision to bring the most current information to council of what the interest rate is and what the interest rates are going to be if we did different terms. But to forecast what those loans would be now to when we might actually borrow the money is impossible to do.
I would disagree, sir, respectfully, but I think it's a given, we're gonna borrow 1.9 in Brussels.
Yes.
So that puts us up to 3.4. And then there's, what did you tell me this morning, another 2 million in the funnel, so that's 5.4, so I think you could take 5.4 at 5% over whatever, 10 to 15 or even 20, and tell us what that amount of interest is going to be and how it impacts us going forward, please.
Okay, I'm gonna go to staff. I'll go to Brad first.
Yeah, I think that's just one clarification I want to make sure that council understands is that, you know, 5 million that everybody keeps throwing numbers around, there's 800,000 of that's the money we're borrowing for the county, which they're paying. We have to show it on our debt.
Right. I didn't think that was part of that, Mr. Roberts. I thought that was a separate.
No, that's included in that number. So there's $800,000 worth of borrowing there that's gonna be actually
Okay,
covered.
then we're down to 4.6, fine.
Sure, yeah. But we are different debenture periods, so we can certainly, I'll, maybe if we can defer that request to our treasurer, whether or not she can figure that out.
Do you have a comment?
If you look in the debt report at the projected debt balances
Where you
section, I
showed the
do have the
5%.
annual forecasted annual repayments there. That includes a 5% interest. So it is in there.
Yeah, I saw the
So
5%.
if you take all the debt, there's a forecasted annual payment at 5% at the different terms of 652,000.
Great, cool.
That's all of them.
That's all of them, and that's still less than the 5% of what we're allowed to do. Sorry,
No,
that's less than half of what Bob was requesting as a limit for repayment amounts.
So the annual repayment of 4.6 million is 650,000 a year? Is that what you just said?
yes.
652.
652,000 a year at 5% at the different terms. Because it's
Different
different,
debenture period.
Stretch over version.
yeah.
That's a 7 points on our taxes every year.
Sorry.
Is it not?
No, it's not, because we've already incorporated in our existing budgets.
Yeah.
The payments for those principal and interest amounts. Right, so they're being carried through in our forecast, right, so. We've accounted for the debt payments in those various things, particularly the debenture one, right, for the largest one, which is the BMC. Recreation Center, we already basically had budgeted in 2022, the debenture payments for that, the project's been deferred. But we're just using those monies and putting it towards that capital cost. So we've already budgeted for it. We agreed that we would use 2.1% of our capital levy, which was going to use to offset that BMG debenture payment. Once you levy that 1 year, that amount of money is there forever, right? You don't have to keep levying it every year to get the same amount to pay that principal.
No, but it's coming out every year.
No, well, you've taken it already, so if you raise 2.1% from taxation, that's there forever. Yeah, right, and so that amount of money is already existing in your tax levy, you don't have to keep asking for it every year. So it doesn't increase each year.
No, I realize that, but
Yeah.
we are paying that much every year.
Right.
Yeah.
But the other alternative, Bob, is to increase, save the money, and then buy everything down the road with depreciated dollars because you've lost over inflation while you had it sitting in the bank waiting to get enough to buy it. That was the whole report that I was trying to explain from Mr. Bloom.
Yeah, I got that, Mr. Mayor, thank you. I have trouble with that, I guess. It's not my lifestyle. Maybe there's a generational difference between all of us on this, but I just have the trouble with paying $650,000 a year in interest.
That's not
That's not
interest.
interest.
That's
Well, that's
principal.
what I asked. I'm sorry, that's what
No,
I
sorry,
asked
that-
for,
that's-
was, interest amount going forward.
Okay, that was principal and interest
Okay.
combined.
Thank you.
Sorry.
I thought that was what I asked for.
Okay,
No,
sorry. Counselor Stephanie.
Yeah, I just want to clarify something too. On the Brussels Fire Department addition parking lot, the annual cost is $101,081. But we're also are taking into consideration how much money the county's giving us for the rent on that piece. So if we never spend a nickel and never have somebody come and use our facilities, we'll never have anything. We got to be able to offset that 101,000 interest, and if you're grabbing 10,000 a month for the use of the facility, that's 120,000. That pays your debt.
The rent from the
For the-
money that the county is
for the
giving us
EMS.
for 10 years. the
Right, so
Counselor
the
Stepler
forecasted
Pays the loan for the 750 or 780.
794.
That is the cost of the EMS part. We have to fund 350 ours to pay our improvement to the fire hall.
You can look at it that way, but at the end of
That's
the
the way
day,
it
if you
is.
never have
That's the way I'm
anything.
looking at it. That's the way it is, Counselor Stepler.
Right, but if you never have anything. Like if we don't have, okay, so we're generating revenues. For these assets. If we don't have any assets. Where are we gonna go?
What, I don't follow the only
So I
one
get-
that
I
I can see that we're gonna
Okay,
potentially
all right,
generate
hang
a
on.
revenue.
Hang on, sorry. I should have stopped this a while ago because it's not supposed to be a debate between counselors. It's supposed to be a debate of council through the chair.
Okay. so
Councilor
Mr.
Fisher,
Chair,
just to clarify something, I do believe the county will have their loan paid off after a 5-year period. Is that correct?
5 years.
5 years.
I thought it
So,
was
but
10, but
no,
fine,
no,
that's
but
fine.
after, no, they're signing a 10-year deal.
Yeah,
But after 5 years, there will be a decrease because they still will be renting. They're still going to be paying some of the costs of the facility. They're just not paying the portion of paying the debenture back because they'd have already paid for the full construction. But the whole idea is that whatever we're collecting for rent from them will compensate us for the fact that they're using our property and some of the facilities there, but also to pay for any maintenance and upkeep down the road to keep the building not apart.
okay,
All right, we have a report that's recommending a motion. As Councillor Stepler pointed out, council has the authority to say yea or nay on any project that comes forward, whether it gets up to the 10% or not. Certainly, it would be more of an event if we ever wanted to go past the 10% because we'd have to comment about the fact that we were going beyond our own policy. Have I read the motion? I have not read the motion. Okay. So, there is a motion that the council of the municipality of Huron needs to approve the policy regarding municipal debt. So again, as it was pointed out, whether you call it a policy, whether you want to call it guideline, it doesn't matter. But it is something in writing for staff to work with before they bring information to council. Do I get a mover and a seconder for the policy at this point? Moved by Councillor Deal, second by the Deputy Mayor. Any other comments or questions? Deputy Mayor.
Thank you, Mr. Mayor. I like Bob. I don't like that either, but you know something, if we don't do something like this, we're handcuffing ourselves and future councils from doing anything. So, this is obviously a new tool. Once it's explained, it was a very good report. It was explained well. I understand it. And that's why I'm going to support it.
Any other comments?
I would just say we've 17 years I've been here, we've done pretty good without a lot of that. Thank you.
All those in favor of the motion as it was read?
Now, Mr. Mayor, please.
It is 9-2 at this point. 8-3.
Thank you, Mr. Mayor.
Motion carries. Thank you, Stephanie, or Stacy. Yeah, they got me riled here tonight. The next one's yours also.
Yeah, the next two.
Go ahead.
So this, the next one is that you receive the second quarter variance report, based on the 2023 budget information for information purposes only. Does anyone have any questions about it? It's pretty straightforward, but if you want me to explain anything, I'd be happy to.
Go ahead, Councillor Fisher.
Thank you, Mr. Mayor. Is this the Brussels Medical Center? The $14,000, that's a tenant that has left.
That's correct.
And hopefully there's a concerted effort to find another tenant.
Yes, there is.
And there was, what did I hear, that the dentist wanted to expand and he's not, that's not happening quickly, or is that still a work in progress? Would that compensate or make up for some of that 14,000?
I'll let the CAO respond to that.
Yeah, first part of your question is, yes, we are working pretty actively to try to find tenants. We've reached out to various medical associations to see if we can find anybody who's interested in locating there. So that could include physiotherapists, optometrists, chiropractors. I may have got another one I'm forgetting off the top of my head. So we've reached out that. It's also listed through the MLS service with our realtor. Space available. There's a sign out front. So that answers that part of that question. So we are marketing it fairly heavily. And yes, we've both myself and our director of community services were up with Mr. Hill, our property manager, to look at the request of the dentist, and we're just trying to figure exactly how that will play out in terms of work. Challenge is that dental office pays at a lower rent than what the previous tenant did, so there'd be certainly a reduction in revenue unless the dentist is willing to consider a higher rent for that portion of space. Those conversations are in progress right now.
Thank you.
Any other questions on this part of the report? Oh, Deputy Mayor.
Yeah, just a quick question, either through you to Stacy or Barry Mills or who's ever in charge of the solar panels. Was that a serious malfunction there with that, or who sort of follows that? Looks like there was a deduction in revenue there from that.
For the wind farm or the,
Oh, I think
Solar farm.
solar panels, I think
There's a comment that the less
Yeah, they've
income was received because of it wasn't working.
yeah, we have had some breakdowns and we're working, and John's working with getting them fixed, like it was switch shut off, that we don't get power. And it happens to get tripped or something.
He's been in the process of trying to get parts replaced
Yeah.
and resolve it.
Oh, okay.
Yeah.
Yeah, I just wondered, like, how often were they, like, is it something that's inspected like weekly to make sure they're working, or?
We get alerts when they go up, when they go down.
Okay,
Yeah.
that's what I how old are these panels now? I know we were sitting here when we brought them in, but it's.
I'm gonna say they're about 11 years.
Yeah.
I thought it was somewhere around 212 or 213.
That sounds familiar, that's what I'm thinking too.
Do I get a mover in a second? Can I get a mover in a second? Councillor Stefan, Councillor Chartrand, all those in favor? All those in favor? Motion carries, thank you. Stacy, I tried reading this. I
Okay,
didn't fully understand the whole thing, so I only have a couple of questions.
okay,
First of all, do we ever get these requests directly?
I am not aware of it, and, with information or sharing information with other municipalities, if it happens, it does not happen often. It's not just something.
I certainly don't. So I guess two things then. One, I'm not sure why we need to delegate the process to somebody else if we never ever do the process.
But on the off or rare chance that someone comes in and wants to do it, I don't believe that as staff that we're really equipped
Okay,
to do it.
all right,
That's just,
that's fair. And I think you did comment in the report that these other people deal with, whenever they get requests, they deal with them.
yeah, they are great at doing this, and, just one of those really strange things that this is one of those items where reassessment does not go through NPAT. And then that handles all our other issues.
Okay, so then my only other concern when I was trying to absorb whatever I was reading was that if we do delegate this service off to them, would they be more lenient than us? And I guess maybe that's hard to answer since we've never done it.
Yeah, I kind of wonder if because they have a structured procedure and they are not familiar with our residents, where here we're in such a small community, people seem to know people, that maybe less empathy will play in. I think they might be a little bit tougher, like, and more fair,
Okay.
where I think some of our staff members may struggle with.
Okay, no, I appreciate that. Councilor Fisher.
Thank you, Mr. Mayor. Stacy, please, if we go to, land tribunal, there's a cost to us, lawyer and staff, et cetera. Would there be any cost incurred if this did happen?
No, there's no cost to this.
Thank you.
Any other questions of council? Get a mover and a seconder, please. Moved by Councilor Newell, second by Councilor Fisher. That the request for decision to delegate tax appeals under section 357, paragraph 1, subsection D1 to the assessment review board. Oh, sorry, that wasn't the motion.
I have it up here too, if you don't want to, it's a long one.
It's okay. That the council of the municipality of Huron needs to approve a bylaw pursuant to section 357, paragraph 11 of the Municipal Act 2001, providing authority to delegate authority to the assessment review board only to exercise council's powers and functions under sections 357, paragraph 1 and 357, paragraph 5 with respect to applications made under subsection 357, paragraph 1, subsection D1 regarding an application for the cancellation, reduction, or refund of taxes where the applicant is unable to pay taxes because of sickness or extreme poverty, and further that the clerk be directed to provide a certified copy of the bylaw to the register of the assessment review board and to the municipal property assessment corporation. All those in favor? And motion carries. Thank you. Correspondence.
The first one here is from Seaforth Agriculture Society. This is their yearly request to have traffic control and road closures for September 16th. To go forward with that one. And then as part of their request, they'd also mentioned that a dignitary be a part of the parade, either in a truck or if they need assistance getting a convertible. So that was just a side.
And I meant to get a hold of that. I think. Does Councilor Fisher have my magnets from last year?
Brought them back.
Did you? Okay, so you have part of them and I have the other part still.
Yeah.
Okay, so that's fine. I will attend on the Saturday. I'm waiting that afternoon, but this will be over long before that. As far as a vehicle goes, I did notice there was an opportunity for other delegates if they wanted to come along. So we could either use the Public Works truck. And if there's enough people, we can put a picnic table in the back, stickers on the door and drive up the road. I'm fine with that. I don't know if Barry's in town or someone else wants to, or I could drive the truck. I don't really care, but
I'm happy to drive over you guys around.
okay. So I would like to open this up. So this Saturday, we start down the Optimus Park. It starts at 10:30. It's not a long parade because we drive basically up to the fairgrounds and at that point it's over, but
It's not this week.
Next Saturday.
oh, sorry, a week, sorry. Yeah, so if anybody is available and would like to show up for it, that would be appreciated.
Very cool over here.
Not till after the fairgrounds.
Yes.
So can I get a mover and a seconder for this, please? Moved by Councilor Chartrand, second by Councilor Fisher. With the council of the municipality of Huron to approve the request for the temporary road closures in Seaforth from 10:30 a.m. on September 16th until 11:15 a.m. on September 16th for the Seaforth Fall Fair Parade. All in favor? And motion carries.
Next one is very similar, but with the Brussels Agriculture Society also requesting intersection closures, and this would be on the September 20th date for theirs.
Can I get a mover and a seconder, please? Moved by Councilor Wilby, second by Councilor Deal. that the council of the municipality of Huron East approve the request for temporary intersection closures on September 20th from 10:30 a.m. until 11:30 a.m. for the Brussels Fall Fair Parade. All those in favor? And motion carries. Seaforth Community Hospital Foundation, Seaforth Hospital Foundation's SKNX Radiothon request to hang a banner. Is it Phil that hangs it? Artec?
That's where the banner's located.
Yeah, I saw his name, so.
Yeah, I'm not sure how in the past this has worked. It sounded like it was a repeat request and they would hand
Do you put the banner up, Barry? Oh, you guys do? Okay.
for the month of October.
Oh, we got the bucket, yeah.
Okay. Can I get a mover and a seconder, please? Moved by Councillor Fisher, second by Councillor Steffler, that the council of the municipality of Huron East approve the request for Seaforth Community Hospital Foundation to hang the Radiothon banner over Highway 8 for the month of October. All those in favor? And motion carries. The Women of Ontario say no legislative amendments to improve municipal codes of conduct and enforcement. Yeah, and I might need a little more background because
Was that the?
Yeah. I have a document. This is, I believe it's going around to all municipalities, from the women who say no, and there have been a couple that they have a sample motion that they provided to us. I just need to pull that up. The other option is to note and file.
when I read this, I understood that Amos supported it, but the province said no.
Amo and Huntington municipality supported it in the past, and then it was turned down by the province, as part of the Bill 5 amendments.
And they want to revisit it.
Yeah.
So
It was
Amo wants it.
Okay, all right. Then do I have a mover and a seconder? And then the first question is this note and file or is this to support? Councillor Fisher.
I move to support.
Okay, and do I have a seconder for that? Councillor Fisher? I read it earlier. Does it, council need it to be read again? Okay, then all of them. And motion carries. Thank you. When I said I read it earlier, I meant this afternoon, not. We are down to council reports. Deputy Mayor.
Thank you, Mr. Mayor. I guess we haven't had a county council meeting. So just a couple of things I've been involved with. There was on August the 11th, I went on a cover crop tour. We toured some local farmers that are involved with cover crops and different kind of tillage and stuff. So I learned a lot about that. We also had a tour of the parish Linebacker elevators in Godrich and watched the big boat there get loaded. It takes 36 hours to load one of them boats like that. And then they get filled so full and then they go out through the canal, get loaded some more in Hamilton, and then they have to wait until they get beyond Montreal, then to finish topping the boats out. So kind of interesting. And they say it's very important. They test all the grain that get loaded at the time. Every 45 seconds, there's a test done for each hold. And then they put together a container of that because they said it's a really bad experience when you send a boat out and it's heading to Mexico and Mexico checks it and they reject the boat. They said it's not the company that rejects it, it's Mexico that rejects it. So then they got to find some place to take it. And it could be because it's detected some sort of an pesticide or insecticide or something like that. So it was quite impressive anyway. So if you ever get a chance to see it. We also toured the Huron View farm to see the different kind of drainage there and the crops there. It's very impressive. The only other thing I had was about AMO. Was at AMO for Monday and Tuesday. Like some of the others, we got to hear the Doug Ford talk about his building homes faster plan, etc. Heard from the NDP leader, very good speech there as well. And leader of the Liberal Party, Mike Schreiner, was there the day after, and he had a very good, passionate speech about his party and climate change challenges. A couple of things I did, I took later in the afternoon. They had, I think, what was it, Brenda called it, like a London tour or something? So I went on one, they loaded you on a bus and I went to Try Recycling. It's a facility, maybe you've heard of it as well. It's maybe kind of northeast of London. Where they aim for 85% of everything that comes through their gate, they recycle. So they do like everything from hydro poles to toilets to shingles to glass. And they broke everything down, told us how they recycle, where the end product goes. So very impressive to see that. The only other thing on Tuesday that was of interest, the Tuesday lunch was with WSIB, Workmen's Compensation Board, and so they just talked about a different change of culture there, and more phone lines and better customer service and communications, stuff like that. A couple of facts, and I think I got it right. They said usually after 1 year, if somebody gets hurt on the job, usually after 1 year, 87% of all the people that get injured are back to work. But those that go off in stress relief 3 years after, they're still only at 50% return, something like that. So just stress is a big thing. So anyway, I think that's all. Thank you, Mr. Chairman.
Thank you. Are there any other boards, committees, meetings, or seminars that anybody want to report on? Councillor Fisher.
Thank you, Mr. Mayor. Just to reinforce what the Deputy Mayor said about AMO, I thought the selection of topics was exceptional this year, one of the better years that I can remember from going to AMO for the last 10, I think. I thought this year was exceptional. And the breakfasts have improved dramatically as well. Thank you.
There was only one thing that and I certainly agree with the deputy mayor's comments on some of the speakers that I was impressed with how well they spoke. There was one section I went to on the Sunday afternoon that actually gave me some input into when we get to 14.1 when it had to do with the cost of arenas and stuff, and I thought it was a pretty interesting session overall.
It was hard to choose between that one and the seniors one, Mr. Mayor.
Well, I still like to think I'm not a senior, so
Yeah,
I like
that's
the arena
right.
one.
There's a reference there.
Are there any requests by members at this time? Are there any notices of motion? Any announcements? Okay.
Just a reminder, Mr. Mayor, tomorrow night is the Blue Earth at the Ag Society, and it's, from what I'm hearing, you better get there early.
Okay.
6 o'clock start.
It is 6 o'clock start, isn't it?
That's my understanding.
Okay, I will pass on one other thing. I have my ticket, but our next council meeting is in Brussels. It is after the opening of the fall fair. But for anybody interested, there is a barbecue dinner prior. So get your tickets, because I know the last time I went, I couldn't get a ticket when I got there because I didn't have one ahead of me. They had sold out. So if you want dinner that night, get your ticket ahead of time.
Where do you buy the tickets from?
I had to give greetings on behalf of the municipality for the ambassador contest in Brussels. And so I bought my ticket that night when I was there.
Any Ag Society?
We can circulate who to reach out to.
Yeah, just send us an email, so it's contact council.
And 14.1, a recommendation from the administration committee. And the motion is that the council of the municipality of Huron East deny the request of the Mid-Huron Huskies for a reduction in the 2023-2024 ice rental rates to the 2022-2023 ice rental rates as recommended by the administration committee. I didn't ask for mover or seconder yet, just in case there was going to be any discussion. We certainly had a lengthy discussion. I think we addressed most of it. If anybody has any questions, I'm pretty sure we can answer them at this point. Councillor Stefan.
Yeah, being that we're losing town hockey, I guess local hockey, going to a greater area, which will be changing again next year by the sounds of it for minor hockey. So it's going to higher, like more amalgamations coming in different municipalities and that. It's all going to be, and I'm sure you guys talked about it, and I trust everyone of you that it's going to be the where you're going to use the ice at what arenas. And are we losing some, are one of our biggest ice users? We can't make special arrangements, I get it. But are we gonna be the last at the dance and not? And have half empty arenas such as Blue Water does over in neighboring? Because of Hensel's are. I'd be concerned that every dollar counts. Where do you cut it? You move away from our 18, 25, 32 hours. Can we replace that in our center?
I'm gonna say yes, we certainly did discuss it and touched on that exact topic. Staff actually had an idea of what hours they would allow them to cut off of their schedule if in fact they decide to carry on with that. We don't even know if they're going to do that if we don't reduce the rate. But if they did, there was opportunity where there were specific hours during the week that had been requested as prime for other groups that couldn't get it in the past because minor hockey had it, where it was easy to move on minor hockey to some weekend schedules where you couldn't rent it to anybody else anyways. So I'm gonna say staff already have a plan in place to move forward with this recommendation.
Thank you.
Any other questions, council? Can I get a mover and a seconder, please? Moved by Councillor Fisher, second by Councillor Newell. All those in favor? Motion carries. Bylaws, can I get a mover and a seconder, please? Moved by Councillor Fisher, second by Councillor Deal, that be it hereby resolved that bylaw 37 for 2023, a bylaw to amend bylaw 52 of 2006, being the zoning bylaw Z01 of 2023 be given first, second, third, and final reading and signed by the mayor and the clerk, and the seal of the corporation be affixed thereto. All these. Motion carries. I forget, Jessica, I put a star beside this one. This
We'll
was,
have to defer that bylaw because it was, the report went back to the engineer.
so just skip this one.
Or just a motion to defer it since it's listed in the body.
Okay, I just need a motion to defer the report from the engineers.
The bylaw.
Motion to defer the bylaw because we deferred the report. Moved by Councillor Deal, second by Councillor Wilby. All those in favor? Motion carries. Can I get a mover and a seconder for bylaw 58? Councillor Morrison, Deputy Mayor, that be it hereby resolved that bylaw 58 of 2023, a bylaw to temporarily close Duke Street and Main Street, County Road 12 for the Seaforth Ball Fair be given first, second, third, and final readings, signed by the mayor and the clerk, and the seal of the corporation be affixed thereto. All in favor? Motion carries. Mover and a seconder for bylaw 59. Councillor Chartrand and Deputy Mayor, that be it hereby resolved that bylaw 59 of 2023, a bylaw to authorize an agreement with Integrated Maintenance and Operation Services, Inc. for winter maintenance be given first, second, third, and final reading, signed by the mayor and the clerk, and the seal of the corporation be affixed thereto. All those in favor? Carried. Mover and a seconder for bylaw 60. Councillor Morrison and Councillor Deal, that be it hereby resolved that bylaw 60 of 2023, a bylaw to appoint deputy division registrars and deputy issuers of marriage licenses be given first, second, third, and final reading, signed by the mayor and the clerk, and the seal of the corporation be affixed thereto. All those in favor? And the motion carries. Mover and a seconder for bylaw 61. Councillor Dalton and Councillor McGrath, that be it hereby resolved that bylaw 61 of 2023, a bylaw to temporarily stop up and close intersections in Brussels for the Brussels Fall Fair be given first, second, third, and final reading, signed by the mayor and the clerk, and the seal of the corporation be affixed thereto. All those in favor? Carried. Motion for bylaw 62. Councillor Morrison, Councillor Deal, that be it hereby resolved that bylaw 62 of 2023, a bylaw to delegate authority to the Assessment Review Board be given first, second, third, and final reading, signed by the mayor and the clerk, and the seal of the corporation be affixed thereto. All those in favor? Motion carries. Skipping by one here. Bylaw 63. Mover and seconder, Councillor Morrison and Councillor Deal, that be it hereby resolved that bylaw 63 of 2023, a bylaw to amend bylaw 52 of 2006, being a zoning bylaw Z08 2023. Was this mine? This one is declared. a
Yes,
conflict
it
of
is. Yes.
interest. Can I do the bylaw? If I've already declared it.
Then you should probably be excused from the bylaw as well.
Thank you.
Probably can't motion.
Yeah. I'm looking for a mover or seconder for this. Counselor Deal and Counselor Stefan. That hereby be resolved that bylaw 63/2023, a bylaw to amend bylaw 52/2006, being a zoning bylaw Z08/2023, be given first, second, third, and final readings, signed by the deputy mayor and clerk, and the seal of the corporation be affixed thereto. Comments or questions? All those in favor? That's carried. Thank you.
Mover and a seconder for bylaw 64. Counselor Wilby, Counselor Morrison, that be it hereby resolved that bylaw 64 of 2023, a bylaw to appoint a deputy clerk and repeal bylaw 102 of 2022, be given first, second, third, and final readings and signed by the mayor and the clerk, and the seal of the corporation be affixed thereto. All those in favor? Motion carries. Motion to go into closed session, please. Moved by Counselor Morrison, second by Counselor Wilby, that a closed meeting of council be held on Tuesday, September 5th of 2023 at 9 o'clock in the town hall council chambers in accordance with section 239 of the Municipal Act 2001 for the purpose of the following matters. 239 paragraph 2 subsection C, the postal disposition of land in Benastra, and that CAO Brad McRoberts, Director of Finance Treasurer Stacy Gaynor, and clerk Jessica Rudy remain in closed session. All in favor? Yeah, motion carries.